Question 1. A male client is being treated for alcoholism. After a family meeting, the client's spouse asks the nurse about ways to help the family deal with the effects of alcoholism. Nurse Lily should suggest that the family join which organization? A. Al-Anon. B. Make Today Count. C. Emotions Anonymous. D. Alcoholics Anonymous. Question 1 Answer. Al-Anon. Question 1 Explanation. Al-Anon is an organization that assists family members to share common experiences and increase their understanding of alcoholism. Make Today Count is a support group for people with life-threatening or chronic illnesses. Emotions Anonymous is a support group for people experiencing depression, anxiety, or similar conditions. Alcoholics Anonymous is an organization that helps alcoholics recover by using a 12-step program. Question 2. A female client who's at high risk for suicide needs close supervision. To best ensure the client's safety, Nurse Mary should A. Check the client frequently at irregular intervals throughout the night. B. Assure the client that the nurse will hold in confidence anything the client says. C. Repeatedly discuss previous suicide attempts with the client. D. Disregard decreased communication by the client because this is common in suicidal clients. Question 2 Answer. Check the client frequently at irregular intervals throughout the night. Question 2 Explanation. Checking the client frequently but at irregular intervals prevents the client from predicting when observation will take place and altering behavior in a misleading way at these times. Option B may encourage the client to try to manipulate the nurse or seek attention for having a secret suicide plan. Option C may reinforce suicidal ideas. Decreased communication is a sign of withdrawal that may indicate the client has decided to commit suicide. The nurse shouldn't disregard it. Option D. Question 3. A male client admitted to the psychiatric unit for treatment of substance abuse says to the nurse, "It felt so wonderful to get high." Which of the following is the most appropriate response? A. If you continue to talk like that, I'm going to stop speaking to you. B. You told me you got fired from your last job for missing too many days after taking drugs all night. C. Tell me more about how it felt to get high. D. Don't you know it's illegal to use drugs? Question 3 Answer. B. You told me you got fired from your last job for missing too many days after taking drugs all night. Question 3 Explanation. Confronting the client with the consequences of substance abuse helps to break through denial. Making threats, option A, isn't an effective way to promote self-disclosure or establish a rapport with the client. Although the nurse should encourage the client to discuss feelings, the discussion should focus on how the client felt before, not during, an episode of substance abuse. Option C. Encouraging elaboration about his experience while getting high may reinforce the abusive behavior. The client undoubtedly is aware that drug use is illegal. A reminder to this effect, option D, is unlikely to alter behavior. Question 4. A male client who reportedly consumes 1 quart of vodka daily is admitted for alcohol detoxification. To try to prevent alcohol withdrawal symptoms, Dr. Smith is most likely to prescribe which drug? A. Clozapine, Clozaril. B. Theophylline, Navane. C. Lorazepam, Ativan. D. Lithium carbonate, Escalith. Question 4 Answer. C. Lorazepam, Ativan. Question 4 Explanation. The best choice for preventing or treating alcohol withdrawal symptoms is lorazepam, a benzodiazepine. Clozapine and theophylline are antipsychotic agents, and lithium carbonate is an anti-manic agent. These drugs aren't used to manage alcohol withdrawal syndrome. Question 5. A male client with a history of cocaine addiction is admitted to the coronary care unit for evaluation of substernal chest pain. The electrocardiogram, ECG, shows a 1 mm street segment elevation. The anteroseptal leads and T-wave inversion in leads V3 to V5. Considering the client's history of drug abuse, Nurse Gregg expects the physician to prescribe A. Lidocaine, xylocaine. B. procainamide, pronostal. C. Nitroglycerin, nitrobid 4. D. Epinephrine. Question 5 Answer: C. Nitroglycerin, nitrobid 4. Question 5 Explanation: the elevated street segments in this client's ECG indicate myocardial ischemia. To reverse this problem, the physician is most likely to prescribe an infusion of nitroglycerin to dilate the coronary arteries. Lidocaine and procainamide are cardiac drugs that may be indicated for this client at some point but aren't used for coronary artery dilation. If a cocaine user experiences ventricular fibrillation or asystole, the physician may prescribe epinephrine. However, this drug must be used with caution because cocaine may potentiate its adrenergic effects. Question 6 Kellen, a high school student, is referred to the school nurse for suspected substance abuse. Following the nurse's assessment and interventions, what would be the most desirable outcome? A. The student discusses conflicts over drug use. B. The student accepts a referral to a substance abuse counselor. C. The student agrees to inform his parents of the problem. D. The student reports increased comfort with making choice. Question 6 Answer: B. The student accepts a referral to a substance abuse counselor. Question 6 Explanation: all of the outcomes stated are desirable, however, the best outcome is that the student would agree to seek the assistance of a professional substance abuse counselor. Question 7 Nurse Penny is aware that the following medical conditions is commonly found in clients with bulimia nervosa. A. Allergies. B. Cancer. C. Diabetes mellitus. D. Hepatitis A. Question 7 Answer: C. Diabetes mellitus. Question 7 Explanation: bulimia nervosa can lead to many complications, including diabetes, heart disease, and hypertension. The eating disorder isn't typically associated with allergies, cancer, or hepatitis A. Question 8 When monitoring a female client recently admitted for treatment of cocaine addiction, Nurse Erin notes sudden increases in the arterial blood pressure and heart rate. To correct these problems, the nurse expects the physician to prescribe A. Norepinephrine, Leveft, and lidocaine, xylocaine. B. Nifedipine, Procardia, and lidocaine. C. Nitroglycerin, nitrobid 4, and ismolol, Brevibloc. D. Nifedipine and ismolol. Question 8 Answer: D. Nifedipine and ismolol. Question 8 Explanation: this client requires a vasodilator, such as nifedipine, to treat hypertension, and a beta-adrenergic blocker, such as ismolol, to reduce the heart rate. Lidocaine, an antiarrhythmic, isn't indicated because the client doesn't have an arrhythmia. Although nitroglycerin may be used to treat coronary vasospasm, it isn't the drug of choice in hypertension. Question 9 Nurse Amy is aware that the client is at highest risk for suicide. A. One who appears depressed, frequently thinks of dying, and gives away all personal possessions. B. One who plans a violent death and has the means readily available. C. One who tells others that he or she might do something if life doesn't get better soon. D. One who talks about wanting to die. Question 9 Answer: B. One who plans a violent death and has the means readily available. Question 9 Explanation: the client at highest risk for suicide is one who plans a violent death, for example, by gunshot, jumping off a bridge, or hanging, has a specific plan, for example, after the spouse leaves for work, and has the means readily available, for example, a rifle hidden in the garage. A client who gives away possessions, thinks about death, or talks about wanting to die or attempting suicide is considered at a lower risk for suicide because this behavior typically serves to alert others that the client is contemplating suicide and wishes to be helped. Question 10 A female client with borderline personality disorder is admitted to the psychiatric unit. Initial nursing assessment reveals that the client's wrists are scratched from a recent suicide attempt. Based on this finding, the nurse Lenny should formulate a nursing diagnosis of A. Ineffective individual coping related to feelings of guilt. B. Situational low self-esteem related to feelings of loss of control. C. Risk for violence, self-directed related to impulsive mutilating acts. D. Risk for violence, directed toward others related to verbal threats. Question 10 Answer: C. Risk for violence, self-directed related to impulsive mutilating acts. Question 10 Explanation: The predominant behavioral characteristic of the client with borderline personality disorder is impulsiveness, especially of a physically self-destructive sort. The observation that the client has scratched wrists doesn't substantiate the other options. Question 11. A male client has approached the nurse asking for advice on how to deal with his alcohol addiction. Nurse Sally should tell the client that the only effective treatment for alcoholism is A. Psychotherapy, B. Total abstinence, C. Alcoholics Anonymous, AA, D. Aversion therapy. Question 11 Answer: B. Total abstinence. Question 11 Explanation: Total abstinence is the only effective treatment for alcoholism. Psychotherapy, attendance at AA meetings, and aversion therapy are all adjunctive therapies that can support the client in his efforts to abstain. Question 12. A parent brings a preschooler to the emergency department for treatment of a dislocated shoulder, which allegedly happened when the child fell down the stairs. Which action should make the nurse suspect that the child was abused? A. The child cries uncontrollably throughout the examination. B. The child pulls away from contact with the physician. C. The child doesn't cry when the shoulder is examined. D. The child doesn't make eye contact with the nurse. Question 12 Answer: C. The child doesn't cry when the shoulder is examined. Question 12 Explanation: A characteristic behavior of abused children is lack of crying when they undergo a painful procedure or are examined by a healthcare professional. Therefore, the nurse should suspect child abuse. Crying throughout the examination, pulling away from the physician, and not making eye contact with the nurse are normal behaviors for preschoolers. Question 13. A client whose husband just left her has a recurrence of anorexia nervosa. Nurse Vic caring for her realizes that this exacerbation of anorexia nervosa results from the client's effort to A. Manipulate her husband, B. Gain control of one part of her life, C. Commit suicide, D. Live up to her mother's expectations. Question 13 Answer: B. Gain control of one part of her life. Question 13 Explanation: By refusing to eat, a client with anorexia nervosa is unconsciously attempting to gain control over the only part of her life she feels she can control. This eating disorder doesn't represent an attempt to manipulate others or live up to their expectations, although anorexia nervosa has a high incidence in families that emphasize achievement. The client isn't attempting to commit suicide through starvation, rather, by refusing to eat, she is expressing feelings of despair, worthlessness, and hopelessness. Question 14. When planning care for a client who has ingested phencyclidine, PCP, Nurse Wayne is aware that the following is the highest priority: A. Client's physical needs, B. Client's safety needs, C. Client's psychosocial needs, D. Client's medical needs. Question 14 Answer: B. Client's safety needs. Question 14 Explanation: The highest priority for a client who has ingested PCP is meeting safety needs of the client as well as the staff. Drug effects are unpredictable and prolonged, and the client may lose control easily. After safety needs have been met, the client's physical, psychosocial, and medical needs can be met. Question 15. A male client tells the nurse he was involved in a car accident while he was intoxicated. What would be the most therapeutic response from Nurse Julia? A. Why didn't you get someone else to drive you? B. Tell me how you feel about the accident. C. You should know better than to drink and drive. D. I recommend that you attend an Alcoholics Anonymous meeting. Question 15 Answer: B. Tell me how you feel about the accident. Question 15 Explanation: An open-ended statement or question is the most therapeutic response. It encourages the widest range of client responses, makes the client an active participant in the conversation, and shows the client that the nurse is interested in his feelings. Asking the client why he drove while intoxicated can make him feel defensive and intimidated. A judgmental approach isn't therapeutic. By giving advice, the nurse suggests that the client isn't capable of making decisions, thus fostering dependency. Question 16. A 25-year-old client experiencing alcohol withdrawal is upset about going through detoxification. Which of the following goals is a priority? A. The client will commit to a drug-free lifestyle. B. The client will work with the nurse to remain safe. C. The client will drink plenty of fluids daily. D. The client will make a personal inventory of strength. Question 16. Answer: B. The client will work with the nurse to remain safe. Question 16. Explanation: the priority goal in alcohol withdrawal is maintaining the client's safety. Committing to a drug-free lifestyle, drinking plenty of fluids, and identifying personal strengths are important goals, but ensuring the client's safety is the nurse's top priority. Question 17. Nurse Mary is caring for a client with bulimia. Strict management of dietary intake is necessary. Which intervention is also important? A. Fill out the client's menu and make sure she eats at least half of what is on her tray. B. Let the client eat her meals in private. Then engage her in social activities for at least 2 hours after each meal. C. Let the client choose her own food. If she eats everything she orders, then stay with her for 1 hour after each meal. D. Let the client eat food brought in by the family if she chooses, but she should keep a strict calorie count. Question 17. Answer: C. Let the client choose her own food. If she eats everything she orders, then stay with her for 1 hour after each meal. Question 17. Explanation: allowing the client to select her own food from the menu will help her feel some sense of control. She must then eat 100% of what she selected. Remaining with the client for at least 1 hour after eating will prevent purging. Bulimic clients should only be allowed to eat food provided by the dietary department. Question 18. Nurse Harry is developing a plan of care for a client with anorexia nervosa. Which action should the nurse include in the plan? A. Restrict visits with the family until the client begins to eat. B. Provide privacy during meals. C. Set up a strict eating plan for the client. D. Encourage the client to exercise, which will reduce her anxiety. Question 18. Answer: C. Set up a strict eating plan for the client. Question 18. Explanation: establishing a consistent eating plan and monitoring the client's weight are important for this disorder. The family should be included in the client's care. The client should be monitored during meals, not given privacy. Exercise must be limited and supervised. Question 19. A male client recently admitted to the hospital with sharp, substernal chest pain suddenly complains of palpitations. Nurse Ryan notes a rise in the client's arterial blood pressure and a heart rate of 144 beats a minute. On further questioning, the client admits to having used cocaine recently after previously denying use of the drug. The nurse concludes that the client is at high risk for which complication of cocaine use? A. Coronary artery spasm. B. Bradyarrhythmias. C. Neurobehavioral deficits. D. Panic disorder. Question 19. Answer: a coronary artery spasm. Question 19. Explanation: cocaine use may cause such cardiac complications as coronary artery spasm, myocardial infarction, dilated cardiomyopathy, acute heart failure, endocarditis, and sudden death. Cocaine blocks reuptake of norepinephrine, epinephrine, and dopamine, causing an excess of these neurotransmitters at postsynaptic receptor sites. Consequently, the drug is more likely to cause tachyarrhythmias than bradyarrhythmias. Although neurobehavioral deficits are common in neonates born to cocaine users, they are rare in adults. As craving for the drug increases, a person who's addicted to cocaine typically experiences euphoria followed by depression, not panic disorder. Question 20. For a female client with anorexia nervosa, Nurse Rose plans to include the parents in therapy sessions along with the client. What fact should the nurse remember to be typical of parents of clients with anorexia nervosa? A. They tend to overprotect their children. B. They usually have a history of substance abuse. C. They maintain emotional distance from their children. D. They alternate between loving and rejecting their children. Question 20 Answer. They tend to overprotect their children. Question 20 Explanation. Clients with anorexia nervosa typically come from a family with parents who are controlling and overprotective. These clients use eating to gain control of an aspect of their lives. The characteristics described in options B, C, and D isn't typical of parents of children with anorexia. Question 21. Nurse Alice is caring for a client being treated for alcoholism. Before initiating therapy with disulfiram and abuse, the nurse teaches the client that he must read labels carefully on which of the following products? A. Carbonated beverages. B. Aftershave lotion. C. Toothpaste. D. Cheese. Question 21 Answer. B. Aftershave lotion. Question 21 Explanation. Disulfiram may be given to clients with chronic alcohol abuse who wish to curb impulse drinking. Disulfiram works by blocking the oxidation of alcohol, inhibiting the conversion of acetaldehyde to acetate. As acetaldehyde builds up in the blood, the client experiences noxious and uncomfortable symptoms. Even alcohol rubbed onto the skin can produce a reaction. The client receiving disulfiram must be taught to read ingredient labels carefully to avoid products containing alcohol such as aftershave lotions. Carbonated beverages, toothpaste, and cheese don't contain alcohol and don't need to be avoided by the client. Question 22. Flumazenol, Romazicon, has been ordered for a male client who has overdosed on oxazepam, Sarax. Before administering the medication, Nurse Gina should be prepared for which common adverse effect? A. Seizures. B. Shivering. C. Anxiety. D. Chest pain. Question 22 Answer. A seizures. Question 22 Explanation. Seizures are the most common serious adverse effect of using flumazenol to reverse benzodiazepine overdose. The effect is magnified if the client has a combined tricyclic antidepressant and benzodiazepine overdose. Less common adverse effects include shivering, anxiety, and chest pain. Question 23. Nurse Tamra is caring for a client diagnosed with bulimia. The most appropriate initial goal for a client diagnosed with bulimia is to A. Avoid shopping for large amounts of food. B. Control eating impulses. C. Identify anxiety-causing situations. D. Eat only 3 meals per day. Question 23 Answer. C. Identify anxiety-causing situations. Question 23 Explanation. Bulimic behavior is generally a maladaptive coping response to stress and underlying issues. The client must identify anxiety-causing situations that stimulate the bulimic behavior and then learn new ways of coping with the anxiety. Controlling shopping for large amounts of food isn't a goal early in treatment. Managing eating impulses and replacing them with adaptive coping mechanisms can be integrated into the plan of care after initially addressing stress and underlying issues. Eating 3 meals per day isn't a realistic goal early in treatment. Question 24. The nurse is aware that the outcome criteria would be appropriate for a child diagnosed with oppositional defiant disorder. A. Accept responsibility for own behaviors. B. Be able to verbalize own needs and assert rights. C. Set firm and consistent limits with the client. D. Allow the child to establish his own limits and boundaries. Question 24 Answer. Accept responsibility for own behaviors. Question 24 Explanation. Children with oppositional defiant disorder frequently violate the rights of others. They are defiant, disobedient, and blame others for their actions. Accountability for their actions would demonstrate progress for the oppositional child. Options C and D aren't outcome criteria but interventions. Option B is incorrect as the oppositional child usually focuses on his own needs. Question 25. During postprandial monitoring, a female client with bulimia nervosa tells the nurse, "You can sit with me, but you're just wasting your time." After you sat with me yesterday, I was still able to purge. Today, my goal is to do it twice. What is the nurse's best response? A. I trust you not to purge. B. How are you purging and when do you do it? C. Don't worry. I won't allow you to purge today. D. I know it's important for you to feel in control, but I'll monitor you for 90 minutes after you eat. Question 25. Answer: D. I know it's important for you to feel in control, but I'll monitor you for 90 minutes after you eat. Question 25. Explanation: this response acknowledges that the client is testing limits and that the nurse is setting them by performing postprandial monitoring to prevent self-induced emesis. Clients with bulimia nervosa need to feel in control of the diet because they feel they lack control over all other aspects of their lives. Because their therapeutic relationships with caregivers are less important than their need to purge, they don't fear betraying the nurse's trust by engaging in the activity. They commonly plot purging and rarely share their secrets about it. An authoritarian or challenging response may trigger a power struggle between the nurse and client. Question 26. Nurse Mary is assigned to care for a suicidal client. Initially, which is the nurse's highest care priority? A. Assessing the client's home environment and relationships outside the hospital. B. Exploring the nurse's own feelings about suicide. C. Discussing the future with the client. D. Referring the client to a clergyperson to discuss the moral implications of suicide. Question 26. Answer: B. Exploring the nurse's own feelings about suicide. Question 26. Explanation: the nurse's values, beliefs, and attitudes towards self-destructive behavior influence responses to a suicidal client. Such responses set the overall mood for the nurse-client relationship. Therefore, the nurse initially must explore personal feelings about suicide to avoid conveying negative feelings to the client. Assessment of the client's home environment and relationships may reveal the need for family therapy. However, conducting such an assessment isn't a nursing priority. Discussing the future and providing anticipatory guidance can help the client prepare for future stress, but this isn't a priority. Referring the client to a clergyperson may increase the client's trust or alleviate guilt, however, it isn't the highest priority. Question 27. Kevin is remanded by the courts for psychiatric treatment. His police record, which dates to his early teenage years, includes delinquency, running away, auto theft, and vandalism. He dropped out of school at age 16 and has been living on his own since then. His history suggests maladaptive coping, which is associated with A. Antisocial personality disorder. B. Borderline personality disorder. C. Obsessive-compulsive personality disorder. D. Narcissistic personality disorder. Question 27. Answer: an antisocial personality disorder. Question 27. Explanation: the client's history of delinquency, running away from home, vandalism, and dropping out of school are characteristic of antisocial personality disorder. This maladaptive coping pattern is manifested by a disregard for societal norms of behavior and an inability to relate meaningfully to others. In borderline personality disorder, the client exhibits mood instability, poor self-image, identity disturbance, and label affect. Obsessive-compulsive personality disorder is characterized by a preoccupation with impulses and thoughts that the client realizes are senseless but can't control. Narcissistic personality disorder is marked by a pattern of self-involvement, grandiosity, and demand for constant attention. Question 28. Clonidine, catapers, can be used to treat conditions other than hypertension. Nurse Sally is aware that the following conditions might the drug be administered: A. Phencyclidine, PCP, intoxication. B. Alcohol withdrawal. C. Opiate withdrawal. D. Cocaine withdrawal. Question 28. Answer: C. Opiate withdrawal. Question 28. Explanation: clonidine is used as adjunctive therapy in opiate withdrawal. Benzodiazepines, such as chlordiazepoxide, Librium, and neuropleptic agents, such as haloperidol, are used to treat alcohol withdrawal. Benzodiazepines and neuroleptic agents are typically used to treat PCP intoxication. Antidepressants and medications with dopaminergic activity in the brain, such as fluoxetine, Prozac, are used to treat cocaine withdrawal. Question 29. Which of the following drugs should Nurse Mary prepare to administer to a client with a toxic acetaminophen, Tylenol, level? A. Difroxamine mesylate, Disferil. B. Succimer, Kemet. C. Flumazenol, Ramazacon. D. Acetylcysteine, Mucomyst. Question 29. Answer: D. Acetylcysteine, Mucomyst. Question 29. Explanation: the antidote for acetaminophen toxicity is acetylcysteine. It enhances conversion of toxic metabolites to non-toxic metabolites. Difroxamine mesylate is the antidote for iron intoxication. Succimer is an antidote for lead poisoning. Flumazenol reverses the sedative effects of benzodiazepines. Question 30. For a female client with anorexia nervosa, Nurse Jimmy is aware that which goal takes the highest priority? A. The client will establish adequate daily nutritional intake. B. The client will make a contract with the nurse that sets a target weight. C. The client will identify self-perceptions about body size as unrealistic. D. The client will verbalize the possible physiological consequences of self-starvation. Question 30. Answer: the client will establish adequate daily nutritional intake. Question 30. Explanation: according to Maslow's hierarchy of needs, all humans need to meet basic physiological needs first. Because a client with anorexia nervosa eats little or nothing, the nurse must first plan to help the client meet this basic, immediate physiological need. The nurse may give lesser priority to goals that address long-term plans, as in option B, self-perception, as in option C, and potential complications, as in option D. Question 31. A 14-year-old client is brought to the clinic by her mother. Her mother expresses concern about her daughter's weight loss and constant dieting. Nurse Crease conducts a health history interview. Which of the following comments indicates that the client may be suffering from anorexia nervosa? A. I like the way I look. I just need to keep my weight down because I'm a cheerleader. B. I don't like the food my mother cooks. I eat plenty of fast food when I'm out with my friends. C. I just can't seem to get down to the weight I want to be. I'm so fat compared to other girls. D. I do diet around my periods, otherwise, I just get so bloated. Question 31. Answer: C. I just can't seem to get down to the weight I want to be. I'm so fat compared to other girls. Question 31. Explanation: low self-esteem is the highest risk factor for anorexia nervosa. Constant dieting to get down to a desirable weight is characteristic of the disorder. Feeling inadequate when compared to peers indicates poor self-esteem. Most clients with anorexia nervosa don't like the way they look, and their self-perception may be distorted. A girl with cachexia may perceive herself to be overweight when she looks in the mirror. Preferring fast food over healthy food is common in this age group. Because of the absence of body fat necessary for proper hormone production, amenorrhea is common in a client with anorexia nervosa. Question 32. A 24-year-old client with anorexia nervosa tells the nurse, "When I look in the mirror, I hate what I see. I look so fat and ugly." Which strategy should the nurse use to deal with the client's distorted perceptions and feelings? A. Avoid discussing the client's perceptions and feelings. B. Focus discussions on food and weight. C. Avoid discussing unrealistic cultural standards regarding weight. D. Provide objective data and feedback regarding the client's weight and attractiveness. Question 32. Answer: D. Provide objective data and feedback regarding the client's weight and attractiveness. Question 32. Explanation: by focusing on reality, this strategy may help the client develop a more realistic body image and gain self-esteem. Option A is inappropriate because discussing the client's perceptions and feeling wouldn't help her to identify, accept, and work through them. Focusing discussions on food and weight would give the client attention for not eating, making option B incorrect. Option C is inappropriate because recognizing unrealistic cultural standards wouldn't help the client establish more realistic weight goals. Question 33. Nurse Helen is assigned to care for a client with anorexia nervosa. Initially, which nursing intervention is most appropriate for this client? A. Providing one-on-one supervision during meals and for 1 hour afterward. B. Letting the client eat with other clients to create a normal mealtime atmosphere. C. Trying to persuade the client to eat and thus restore nutritional balance. D. Giving the client as much time to eat as desired. Question 33. Answer: A. Providing one-on-one supervision during meals and for 1 hour afterward. Question 33. Explanation: Because the client with anorexia nervosa may discard food or induce vomiting in the bathroom, the nurse should provide one-on-one supervision during meals and for 1 hour afterward. Option B wouldn't be therapeutic because other clients may urge the client to eat and give attention for not eating. Option C would reinforce control issues, which are central to this client's underlying psychological problem. Instead of giving the client unlimited time to eat, as in option D, the nurse should set limits and let the client know what is expected. Question 34. A female client with anorexia nervosa describes herself as a whale. However, the nurse's assessment reveals that the client is 5'8 inches, 1.7 meters, tall and weighs only 90 pounds, 40.8 kilograms. Considering the client's unrealistic body image, which intervention should Nurse Angel be included in the plan of care? A. Asking the client to compare her figure with magazine photographs of women her age. B. Assigning the client to group therapy in which participants provide realistic feedback about her weight. C. Confronting the client about her actual appearance during one-on-one sessions, scheduled during each shift. D. Telling the client of the nurse's concern for her health and desire to help her make decisions to keep her healthy. Question 34. Answer: D. Telling the client of the nurse's concern for her health and desire to help her make decisions to keep her healthy. Question 34. Explanation: A client with anorexia nervosa has an unrealistic body image that causes consumption of little or no food. Therefore, the client needs assistance with making decisions about health. Instead of protecting the client's health, options A, B, and C may serve to make the client defensive and more entrenched in her unrealistic body image. Question 35. In the emergency department, a client with facial lacerations states that her husband beat her with a shoe. After the healthcare team repairs her lacerations, she waits to be seen by the crisis intake nurse, who will evaluate the continued threat of violence. Suddenly the client's husband arrives, shouting that he wants to finish the job. What is the first priority of the healthcare worker who witnesses this scene? A. Remaining with the client and staying calm. B. Calling a security guard and another staff member for assistance. C. Telling the client's husband that he must leave at once. D. Determining why the husband feels so angry. Question 35. Answer: B. Calling a security guard and another staff member for assistance. Question 35. Explanation: The healthcare worker who witnesses this scene must take precautions to ensure personal as well as client safety, but shouldn't attempt to manage a physically aggressive person alone. Therefore, the first priority is to call a security guard and another staff member. After doing this, the healthcare worker should inform the husband what is expected, speaking in concise statements and maintaining a firm but calm demeanor. This approach makes it clear that the healthcare worker is in control and may defuse the situation until the security guard arrives. Telling the husband to leave would probably be ineffective because of his agitated and irrational state. Exploring his anger doesn't take precedence over safeguarding the client and staff. Question 36. A female client begins to experience alcoholic hallucinosis. Nurse Joy is aware that the best nursing intervention at this time: A. Keeping the client restrained in bed. B. Checking the client's blood pressure every 15 minutes and offering juices. C. Providing a quiet environment and administering medication as needed and prescribed. D. Restraining the client and measuring blood pressure every 30 minutes. Question 36 Answer. C. Providing a quiet environment and administering medication as needed and prescribed. Question 36 Explanation. Manifestations of alcoholic hallucinosis are best treated by providing a quiet environment to reduce stimulation and administering prescribed central nervous system depressants in dosages that control symptoms without causing over-sedation. Although bed rest is indicated, restraints are unnecessary unless the client poses a danger to himself or others. Also, restraints may increase agitation and make the client feel trapped and helpless when hallucinating. Offering juice is appropriate, but measuring blood pressure every 15 minutes would interrupt the client's rest. To avoid overstimulating the client, the nurse should check blood pressure every 2 hours. Question 37. A male adult client voluntarily admits himself to the substance abuse unit. He confesses that he drinks 1 quart or more of vodka each day and uses cocaine occasionally. Later that afternoon, he begins to show signs of alcohol withdrawal. What are some early signs of this condition? A. Vomiting, diarrhea, and bradycardia. B. Dehydration, temperature above 101 degrees Fahrenheit, 38.3 degrees Celsius, and pruritus. C. Hypertension, diaphoresis, and seizures. D. Diaphoresis, tremors, and nervousness. Question 37 Answer. D. Diaphoresis, tremors, and nervousness. Question 37 Explanation. Alcohol withdrawal syndrome includes alcohol withdrawal, alcoholic hallucinosis, and alcohol withdrawal delirium, formerly delirium tremens. Signs of alcohol withdrawal include diaphoresis, tremors, nervousness, nausea, vomiting, malaise, increased blood pressure and pulse rate, sleep disturbance, and irritability. Although diarrhea may be an early sign of alcohol withdrawal, tachycardia, not bradycardia, is associated with alcohol withdrawal. Dehydration and an elevated temperature may be expected, but a temperature above 101 degrees Fahrenheit indicates an infection rather than alcohol withdrawal. Pruritus rarely occurs in alcohol withdrawal. If withdrawal symptoms remain untreated, seizures may arise later. Question 38. A male client is brought to the psychiatric clinic by family members, who tell the admitting nurse that the client repeatedly drives while intoxicated despite their pleas to stop. During an interview with the nurse Linda, which statement by the client most strongly supports a diagnosis of psychoactive substance abuse? A. I'm not addicted to alcohol. In fact, I can drink more than I used to without being affected. B. I only spend half of my paycheck at the bar. C. I just drink to relax after work. D. I know I've been arrested 3 times for drinking and driving, but the police are just trying to hassle me. Question 38 Answer. D. I know I've been arrested 3 times for drinking and driving, but the police are just trying to hassle me. Question 38 Explanation. According to the Diagnostic and Statistical Manual of Mental Disorders, 4th edition, diagnostic criteria for psychoactive substance abuse include a maladaptive pattern of such use, indicated either by continued use despite knowledge of having a persistent or recurrent social, occupational, psychological, or physical problem caused or exacerbated by substance abuse or recurrent use in dangerous situations, for example, while driving. For this client, psychoactive substance dependence must be ruled out. Criteria for this disorder include a need for increasing amounts of the substance to achieve intoxication. Option A, increased time and money spent on the substance. Option B, inability to fulfill role obligations. Option C, untypical withdrawal symptoms. Question 39. A male client is being admitted to the substance abuse unit for alcohol detoxification. As part of the intake interview, the nurse asks him when he had his last alcoholic drink. He says that he had his last drink 6 hours before admission. Based on this response, Nurse Lorena should expect early withdrawal symptoms to A. Begin after 7 days. B. Not occur at all because the time period for their occurrence has passed. C. Begin anytime within the next 1 to 2 days. D. Begin within 2 to 7 days. Question 39 Answer: C. Begin anytime within the next 1 to 2 days. Question 39 Explanation: Acute withdrawal symptoms from alcohol may begin 6 hours after the client has stopped drinking and peak 1 to 2 days later. Delirium tremens may occur 2 to 4 days, even up to 7 days, after the last drink. Question 40. Nurse Faye is aware that the drug of choice for treating Tourette syndrome: A. Fluoxetine, Prozac. B. Fluvoxamine, Luvox. C. Haloperidol, Haldol. D. Paroxetine, Paxil. Question 40 Answer: C. Haloperidol, Haldol. Question 40 Explanation: Haloperidol is the drug of choice for treating Tourette syndrome. Prozac, Luvox, and Paxil are antidepressants and aren't used to treat Tourette syndrome. Question 41. When interviewing the parents of an injured child, which of the following is the strongest indicator that child abuse may be a problem? A. The injury isn't consistent with the history or the child's age. B. The mother and father tell different stories regarding what happened. C. The family is poor. D. The parents are argumentative and demanding with emergency department personnel. Question 41 Answer: A. The injury isn't consistent with the history or the child's age. Question 41 Explanation: When the child's injuries are inconsistent with the history given or impossible because of the child's age and developmental stage, the emergency department nurse should be suspicious that child abuse is occurring. The parents may tell different stories because their perception may be different regarding what happened. If they change their story when different healthcare workers ask the same question, this is a clue that child abuse may be a problem. Child abuse occurs in all socioeconomic groups. Parents may argue and be demanding because of the stress of having an injured child. Question 42. A male client is found sitting on the floor of the bathroom in the day treatment clinic with moderate lacerations on both wrists. Surrounded by broken glass, she sits staring blankly at her bleeding wrists while staff members call for an ambulance. How should Nurse Anuktakanyuk approach her initially? A. Enter the room quietly and move beside her to assess her injuries. B. Call for staff backup before entering the room and restraining her. C. Move as much glass away from her as possible and sit next to her quietly. D. Approach her slowly while speaking in a calm voice, calling her name, and telling her that the nurse is here to help her. Question 42 Answer: D. Approach her slowly while speaking in a calm voice, calling her name, and telling her that the nurse is here to help her. Question 42 Explanation: Ensuring the safety of the client and the nurse is the priority at this time. Therefore, the nurse should approach the client cautiously while calling her name and talking to her in a calm, confident manner. The nurse should keep in mind that the client shouldn't be startled or overwhelmed. After explaining that the nurse is there to help, the nurse should observe the client's response carefully. If the client shows signs of agitation or confusion or poses a threat, the nurse should retreat and request assistance. The nurse shouldn't attempt to sit next to the client or examine injuries without first announcing the nurse's presence and assessing the dangers of the situation. Question 43. A male client is admitted to the substance abuse unit for alcohol detoxification. Which of the following medications is Nurse Alice most likely to administer to reduce the symptoms of alcohol withdrawal? A. Naloxone, Narcan. B. Haloperidol, Haldol. C. Magnesium sulfate. D. Chlordiazepoxide, Librium. Question 43 Answer: D. Chlordiazepoxide, Librium. Question 43 Explanation: Chlordiazepoxide, Librium, and other tranquilizers help reduce the symptoms of alcohol withdrawal. Haloperidol, Haldol, may be given to treat clients with psychosis, severe agitation, or delirium. Naloxone, Narcan, is administered for narcotic overdose. Magnesium sulfate and other anticonvulsant medications are only administered to treat seizures if they occur during withdrawal. Question 44. Nurse Taylor is aware that the victims of domestic violence should be assessed for what important information? A. Reasons they stay in the abusive relationship, for example, lack of financial autonomy and isolation. B. Readiness to leave the perpetrator and knowledge of resources. C. Use of drugs or alcohol. D. History of previous victimization. Question 44 Answer. B. Readiness to leave the perpetrator and knowledge of resources. Question 44 Explanation. Victims of domestic violence must be assessed for their readiness to leave the perpetrator and their knowledge of the resources available to them. Nurses can then provide the victims with information and options to enable them to leave when they are ready. The reasons they stay in the relationship are complex and can be explored at a later time. The use of drugs or alcohol is irrelevant. There is no evidence to suggest that previous victimization results in a person seeking or causing abusive relationships. Question 45. Nurse Bella is aware that assessment finding is most consistent with early alcohol withdrawal. A. Heart rate of 120 to 140 beats, minute. B. Heart rate of 50 to 60 beats, minute. C. Blood pressure of 170th millimeter Hg. D. Blood pressure of 140th millimeter Hg. Question 45 Answer. A heart rate of 120 to 140 beats, minute. Question 45 Explanation. Tachycardia, a heart rate of 120 to 140 beats, minute, is a common sign of alcohol withdrawal. Blood pressure may be labile throughout withdrawal, fluctuating at different stages. Hypertension typically occurs in early withdrawal. Hypotension, although rare during the early withdrawal stages, may occur in later stages. Hypotension is associated with cardiovascular collapse and most commonly occurs in clients who don't receive treatment. The nurse should monitor the client's vital signs carefully throughout the entire alcohol withdrawal process. Question 46. A male client is admitted to a psychiatric facility by court order for evaluation for antisocial personality disorder. This client has a long history of initiating fights and abusing animals and recently was arrested for setting a neighbor's dog on fire. When evaluating this client for the potential for violence, Nurse Berry should assess for which behavioral clues. A. A rigid posture, restlessness, and glaring. B. Depression and physical withdrawal. C. Silence and non-compliance. D. Hypervigilance and talk of past violent acts. Question 46 Answer. A rigid posture, restlessness, and glaring. Question 46 Explanation. Behavioral clues that suggest the potential for violence include a rigid posture, restlessness, glaring, a change in usual behavior, clenched hands, overtly aggressive actions, physical withdrawal, noncompliance, overreaction, hostile threats, recent alcohol ingestion or drug use, talk of past violent acts, inability to express feelings, repetitive demands and complaints, argumentativeness, profanity, disorientation, inability to focus attention, hallucinations or delusions, paranoid ideas or suspicions, and somatic complaints. Violent clients rarely exhibit depression, silence, or hypervigilance. Question 47. A female client is admitted to the psychiatric clinic for treatment of anorexia nervosa. To promote the client's physical health, Nurse Ter should plan to A. Severely restrict the client's physical activities. B. Weigh the client daily, after the evening meal. C. Monitor vital signs, serum electrolyte levels, and acid-base balance. D. Instruct the client to keep an accurate record of food and fluid intake. Question 47 Answer. C. Monitor vital signs, serum electrolyte levels, and acid-base balance. Question 47 Explanation. An anorexic client who requires hospitalization is in poor physical condition from starvation and may die as a result of arrhythmias, hypothermia, malnutrition, infection, or cardiac abnormalities secondary to electrolyte imbalances. Therefore, monitoring the client's vital signs, serum electrolyte level, and acid-base balance is crucial. Option A may worsen anxiety. Option B is incorrect because a weight obtained after breakfast is more accurate than one obtained after the evening meal. Option D would reward the client with attention for not eating and reinforce the control issues that are central to the underlying psychological problem. Also, the client may record food and fluid intake inaccurately. Question 48. 18 hours after undergoing an emergency appendectomy, a client with a reported history of social drinking displays these vital signs: temperature, 101.6 degrees Fahrenheit, 38.7 degrees Celsius, heart rate, 126 beats/minute, respiratory rate, 24 breaths/minute, and blood pressure, 140/96 mm/Hg. The client exhibits gross hand tremors and is screaming for someone to kill the bugs in the bed. Nurse Melinda should suspect A. A postoperative infection. B. Alcohol withdrawal. C. Acute sepsis. D. Pneumonia. Question 48. Answer: B. Alcohol withdrawal. Question 48. Explanation: the client's vital signs and hallucinations suggest delirium tremens or alcohol withdrawal syndrome. Although infection, acute sepsis, and pneumonia may arise as postoperative complications, they wouldn't cause this client's signs and symptoms and typically would occur later in the postoperative course. Question 49. A male client is hospitalized with fractures of the right femur and right humerus sustained in a motorcycle accident. Police suspect the client was intoxicated at the time of the accident. Laboratory tests reveal a blood alcohol level of 0.2%, 200 mg/dl. The client later admits to drinking heavily for years. During hospitalization, the client periodically complains of tingling and numbness in the hands and feet. Nurse Jian realizes that these symptoms probably result from A. Acetate accumulation. B. Thiamine deficiency. C. Triglyceride buildup. D. A below normal serum potassium level. Question 49. Answer: B. Thiamine deficiency. Question 49. Explanation: numbness and tingling in the hands and feet are symptoms of peripheral polyneuritis, which results from inadequate intake of vitamin B1, thiamine, secondary to prolonged and excessive alcohol intake. Treatment includes reducing alcohol intake, correcting nutritional deficiencies through diet and vitamin supplements, and preventing such residual disabilities as foot and wrist drop. Acetate accumulation, triglyceride buildup, and a below normal serum potassium level are unrelated to the client's symptoms. Question 50. McCoy and Helen seek emergency crisis intervention because he slapped her repeatedly the night before. The husband indicates that his childhood was marred by an abusive relationship with his father. When intervening with this couple, Nurse Jerry knows they are at risk for repeated violence because the husband A. has only moderate impulse control. B. denies feelings of jealousy or possessiveness. C. has learned violence as an acceptable behavior. D. feels secure in his relationship with his wife. Question 50. Answer: C. has learned violence as an acceptable behavior. Question 50. Explanation: family violence usually is a learned behavior, and violence typically leads to further violence, putting this couple at risk. Repeated slapping may indicate poor, not moderate, impulse control. Violent people commonly are jealous and possessive and feel insecure in their relationships. Question 51. Mental health is defined as A. the ability to distinguish what is real from what is not. B. a state of well-being where a person can realize his own abilities, can cope with normal stresses of life and work productively. C. is the promotion of mental health, prevention of mental disorders, nursing care of patients during illness and rehabilitation. D. absence of mental illness. Question 51. Answer: B. a state of well-being where a person can realize his own abilities, can cope with normal stresses of life and work productively. Question 51. Explanation: mental health is a state of emotional and psychosocial well-being. A mentally healthy individual is self-aware and self-directive, has the ability to solve problems, can cope with crisis without assistance beyond the support of family and friends, fulfill the capacity to love and work, and sets goals and realistic limits. A. This describes the ego function reality testing. C. This is the definition of mental health and psychiatric nursing. D. Mental health is not just the absence of mental illness. Question 52. Which of the following describes the role of a technician? A. Administers medications to a schizophrenic patient. B. The nurse feeds and bathes a catatonic client. C. Coordinates diverse aspects of care rendered to the patient. D. Disseminates information about alcohol and its effects. Question 52. Answer: administers medications to a schizophrenic patient. Question 52. Explanation: administration of medications and treatments, assessment, documentation are the activities of the nurse as a technician. B. Activities as a parent surrogate. C. Refers to the ward manager role. D. Role as a teacher. Question 53. Letty says, "Give me 10 minutes to recall the name of our college professor who failed many students in our anatomy class." She is operating on her A. Subconscious. B. Conscious. C. Unconscious. D. Ego. Question 53. Answer: a subconscious. Question 53. Explanation: subconscious refers to the materials that are partly remembered, partly forgotten, but these can be recalled spontaneously and voluntarily. B. This functions when one is awake. One is aware of his thoughts, feelings, actions, and what is going on in the environment. C. The largest portion of the mind that contains the memories of one's past, particularly the unpleasant. It is difficult to recall the unconscious content. D. The conscious self that deals and tests reality. Question 54. The superego is that part of the psyche that A. Uses defensive function for protection. B. Is impulsive and without morals. C. Determines the circumstances before making decisions. D. The censoring portion of the mind. Question 54. Answer: D. The censoring portion of the mind. Question 54. Explanation: the critical censoring portion of one's personality, the conscience. A. This refers to the ego function that protects itself from anything that threatens it. B. The id is composed of the untamed, primitive drives and impulses. C. This refers to the ego that acts as the moderator of the struggle between the id and the superego. Question 55. Primary level of prevention is exemplified by A. Helping the client resume self-care. B. Ensuring the safety of a suicidal client in the institution. C. Teaching the client stress management techniques. D. Case finding and surveillance in the community. Question 55. Answer: C. Teaching the client stress management techniques. Question 55. Explanation: primary level of prevention refers to the promotion of mental health and prevention of mental illness. This can be achieved by rendering health teachings such as modifying one's responses to stress. A. This is tertiary level of prevention that deals with rehabilitation. B and D. Secondary level of prevention, which involves reduction of actual illness through the early detection and treatment of illness. Question 56. Situation: in a home visit done by the nurse, she suspects that the wife and her child are victims of abuse. Which of the following is the most appropriate for the nurse to ask? A. Are you being threatened or hurt by your partner? B. Are you frightened of your partner? C. Is something bothering you? D. What happens when you and your partner argue? Question 56. Answer: are you being threatened or hurt by your partner? Question 56. Explanation: the nurse validates her observation by asking simple, direct question. This also shows empathy. B, C, and D are indirect questions which may not lead to the discussion of abuse. Question 57. The wife admits that she is a victim of abuse and opens up about her persistent distaste for sex. This sexual disorder is A. Sexual desire disorder. B. Sexual arousal disorder. C. Orgasm disorder. D. Sexual pain disorder. Question 57. Answer: A sexual desire disorder. Question 57 explanation. Has little or no sexual desire or has distaste for sex. B. Failure to maintain the physiologic requirements for sexual intercourse. C. Persistent and recurrent inability to achieve an orgasm. D. Also called dyspareunia. Individuals with this disorder suffer genital pain before, during and after sexual intercourse. Question 58. Has little or no sexual desire or has distaste for sex. B. Failure to maintain the physiologic requirements for sexual intercourse. C. Persistent and recurrent inability to achieve an orgasm. D. Also called dyspareunia. Individuals with this disorder suffer genital pain before, during and after sexual intercourse. A. Here's the number of a crisis center that you can call for help. B. It's best to leave your husband. C. Did you discuss this with your family? D. Why do you allow yourself to be treated this way? Question 58 answer. Here's the number of a crisis center that you can call for help. Question 58 explanation. Protection is a priority concern in abuse. Help the victim to develop a plan to ensure safety. B. Do not give advice to leave the abuser. Making decisions for the victim further erodes her esteem. However, discuss options available. C. The victim tends to isolate from friends and family. D. This is judgmental. Avoid in any way implying that she is at fault. Question 59. Which comment about a 3-year-old child, if made by the parent, may indicate child abuse? A. Once my child is toilet trained, I can still expect her to have some. B. When I tell my child to do something once, I don't expect to have to tell. C. My child is expected to try to do things such as dress and feed. D. My 3-year-old loves to say no. Question 59 answer. B. When I tell my child to do something once, I don't expect to have to tell. Question 59 explanation. Abusive parents tend to have unrealistic expectations on the child. A, B and C are realistic expectations on a 3-year-old. Question 60. The primary nursing intervention for a victim of child abuse is A. Assess the scope of the problem. B. Analyze the family dynamics. C. Ensure the safety of the victim. D. Teach the victim coping skills. Question 60 answer. C. Ensure the safety of the victim. Question 60 explanation. The priority consideration is the safety of the victim. Attend to the physical injuries to ensure the physiologic safety and integrity of the child. Reporting suspected case of abuse may deter recurrence of abuse. A, B and D may be addressed later. Question 61. Situation. A 30-year-old male employee frequently complains of low back pain that leads to frequent absences from work. Consultation and tests reveal negative results. The client has which somatoform disorder? A. Somatization disorder. B. Hypochondriasis. C. Conversion disorder. D. Somatoform pain disorder. Question 61 answer. D. Somatoform pain disorder. Question 61 explanation. This is characterized by severe and prolonged pain that causes significant distress. A. This is a chronic syndrome of somatic symptoms that cannot be explained medically and is associated with psychosocial distress. B. This is an unrealistic preoccupation with a fear of having a serious illness. C. Characterized by alteration or loss in sensory or motor function resulting from a psychological conflict. Question 62. Freud explains anxiety as A. Strives to gratify the needs for satisfaction and security. B. Conflict between id and superego. C. A hypothalamic pituitary adrenal reaction to stress. D. A conditioned response to stressors. Question 62 answer. B. Conflict between id and superego. Question 62 explanation. Freud explains anxiety as due to opposing action drives between the id and the superego. A. Sullivan identified two types of needs, satisfaction and security. Failure to gratify these needs may result in anxiety. C. Biomedical perspective of anxiety. D. Explanation of anxiety using the behavioral model. Question 63. The following are appropriate nursing diagnosis for the client except A. Ineffective individual coping. B. Alteration in comfort, pain. C. Altered role performance. D. Impaired social interaction. Question 63. Answer. D. Impaired social interaction. Question 63. Explanation. The client may not have difficulty in social exchange. The cues do not support this diagnosis. A. The client maladaptively uses body symptoms to manage anxiety. B. The client will have discomfort due to pain. C. The client may fail to meet environmental expectations due to pain. Question 64. The following statements describe somatoform disorders. A. Physical symptoms are explained by organic causes. B. It is a voluntary expression of psychological conflicts. C. Expression of conflicts through bodily symptoms. D. Management entails a specific medical treatment. Question 64. Answer. C. Expression of conflicts through bodily symptoms. Question 64. Explanation. Bodily symptoms are used to handle conflicts. A. Manifestations do not have an organic basis. B. This occurs unconsciously. D. Medical treatment is not used because the disorder does not have a structural or organic basis. Question 65. What would be the best response to the client's repeated complaints of pain? A. I know the feeling is real. Tests revealed negative results. B. I think you're exaggerating things a little bit. C. Try to forget this feeling and have activities to take it off your mind. D. So tell me more about the pain. Question 65. Answer. I know the feeling is real. Tests revealed negative results. Question 65. Explanation. Shows empathy and offers information. B. This is a demeaning statement. C. This belittles the client's feelings. D. Giving undue attention to the physical symptom reinforces the complaint. Question 66. Situation. A nurse may encounter children with mental disorders. Her knowledge of these various disorders is vital. When planning school interventions for a child with a diagnosis of attention deficit hyperactivity disorder, a guide to remember is to A. Provide as much structure as possible for the child. B. Ignore the child's overactivity. C. Encourage the child to engage in any play activity to dissipate energy. D. Remove the child from the classroom when disruptive behavior occurs. Question 66. Answer. A. Provide as much structure as possible for the child. Question 66. Explanation. Decrease stimuli for behavior control through an environment that is free of distractions, a calm non-confrontational approach and setting limit to time allotted for activities. B. The child will not benefit from a lenient approach. C. Dissipate energy through safe activities. D. This indicates that the classroom environment lacks structure. Question 67. The child with conduct disorder will likely demonstrate A. Easy distractibility to external stimuli. B. Ritualistic behaviors. C. Preference for inanimate objects. D. Serious violations of age-related norms. Question 67. Answer. D. Serious violations of age-related norms. Question 67. Explanation. This is a disruptive disorder among children characterized by more serious violations of social standards such as aggression, vandalism, stealing, lying and truancy. A. This is characteristic of attention deficit disorder. B and C. These are noted among children with autistic disorder. Question 68. Ritalin is the drug of choice for children with ADHD. The side effects of the following may be noted. A. Increased attention span and concentration. B. Increase in appetite. C. Sleepiness and lethargy. D. Bradycardia and diarrhea. Question 68. Answer. Increased attention span and concentration. Question 68. Explanation. The medication has a paradoxic effect that decrease hyperactivity and impulsivity among children with ADHD. B, C, D. Side effects of Ritalin include anorexia, insomnia, diarrhea and irritability. Question 69. School phobia is usually treated by A. Returning the child to the school immediately with family support. B. Calmly explaining why attendance in school is necessary. C. Allowing the child to enter the school before the other children. D. Allowing the parent to accompany the child in the classroom. Question 69. Answer: A. Returning the child to the school immediately with family support. Question 69. Explanation: Exposure to the feared situation can help in overcoming anxiety. A. This will not help in relieving the anxiety due separation from a significant other. C. And C. Anxiety in school phobia is not due to being in school but due to separation from parents, caregivers, so these interventions are not applicable. D. This will not help the child overcome the fear. Question 70. A 10-year-old child has very limited vocabulary and interaction skills. She has an IQ of 45. She is diagnosed to have mental retardation of this classification. A. Profound. B. Mild. C. Moderate. D. Severe. Question 70. Answer: C. Moderate. Question 70. Explanation: The child with moderate mental retardation has an IQ of 35-50. Profound mental retardation has an IQ of below 70. Mild mental retardation 50-70 and severe mental retardation has an IQ of 70-35. Question 71. The nurse teaches the parents of a mentally retarded child regarding her care. The following guidelines may be taught except A. Overprotection of the child. B. Patience, routine and repetition. C. Assisting the parents set realistic goals. D. Giving reasonable compliments. Question 71. Answer: Overprotection of the child. Question 71. Explanation: The child with mental retardation should not be overprotected but need protection from injury and the teasing of other children. B, C, and D. Children with mental retardation have learning difficulty. They should be taught with patience and repetition, start from simple to complex, use visuals and complement them for motivation. Realistic expectations should be set and optimize their capability. Question 72. The parents express apprehensions on their ability to care for their maladaptive child. The nurse identifies what nursing diagnosis. A. Hopelessness. B. Altered parenting role. C. Altered family process. D. Ineffective coping. Question 72. Answer: B. Altered parenting role. Question 72. Explanation: Altered parenting role refers to the inability to create an environment that promotes optimum growth and development of the child. This is reflected in the parent's inability to care for the child. A. This refers to lack of choices or inability to mobilize one's resources. C. Refers to change in family relationship and function. D. Ineffective coping is the inability to form valid appraisal of the stressor or inability to use available resources. Question 73. A 5-year-old boy is diagnosed to have autistic disorder. Which of the following manifestations may be noted in a client with autistic disorder? A. Argumentativeness, disobedience, angry outburst. B. Intolerance to change, disturbed relatedness, stereotypes. C. Distractibility, impulsiveness and overactivity. D. Aggression, truancy, stealing, lying. Question 73. Answer: B. Intolerance to change, disturbed relatedness, stereotypes. Question 73. Explanation: These are manifestations of autistic disorder. A. These manifestations are noted in oppositional defiant disorder, a disruptive disorder among children. C. These are manifestations of attention deficit disorder. D. These are the manifestations of conduct disorder. Question 74. The therapeutic approach in the care of an autistic child include the following except A. Engage in diversionary activities when acting out. B. Provide an atmosphere of acceptance. C. Provide safety measures. D. Rearrange the environment to activate the child. Question 74 Answer. D. Rearrange the environment to activate the child. Question 74 Explanation. The child with autistic disorder does not want change. Maintaining a consistent environment is therapeutic. A. Angry outburst can be rechanneled through safe activities. B. Acceptance enhances a trusting relationship. C. Ensure safety from self-destructive behaviors like head banging and hair pulling. Question 75. According to Piaget, a 5-year-old is in what stage of development? A. Sensory motor stage. B. Concrete operations. C. Pre-operational. D. Formal operation. Question 75 Answer. C. Pre-operational. Question 75 Explanation. Pre-operational stage, 2-7 years, is the stage when the use of language, the use of symbols and the concept of time occur. A. Sensory motor stage, 0-2 years, is the stage when the child uses the senses in learning about the self and the environment through exploration. B. Concrete operations, 7-12 years, when inductive reasoning develops. D. Formal operations, 2 till adulthood, is when abstract thinking and deductive reasoning develop. Question 76. Situation. The nurse assigned in the detoxification unit attends to various patients with substance-related disorders. A 45-year-old male revealed that he experienced a marked increase in his intake of alcohol to achieve the desired effect. This indicates A. Withdrawal. B. Tolerance. C. Intoxication. D. Psychological dependence. Question 76 Answer. B. Tolerance. Question 76 Explanation. Tolerance refers to the increase in the amount of the substance to achieve the same effects. A. Withdrawal refers to the physical signs and symptoms that occur when the addictive substance is reduced or withheld. B. Intoxication refers to the behavioral changes that occur upon recent ingestion of a substance. D. Psychological dependence refers to the intake of the substance to prevent the onset of withdrawal symptoms. Question 77. The client admitted for alcohol detoxification develops increased tremors, irritability, hypertension and fever. The nurse should be alert for impending A. Delirium tremens. B. Korsakoff's syndrome. C. Esophageal varices. D. Wernicke's syndrome. Question 77 Answer. A delirium tremens. Question 77 Explanation. Delirium tremens is the most extreme central nervous system irritability due to withdrawal from alcohol. B. This refers to an amnestic syndrome associated with chronic alcoholism due to a deficiency in Vit. B. C. This is a complication of liver cirrhosis which may be secondary to alcoholism. D. This is a complication of alcoholism characterized by irregularities of eye movements and lack of coordination. Question 78. The care for the client places priority to which of the following? A. Monitoring his vital signs every hour. B. Providing a quiet, dim room. C. Encouraging adequate fluids and nutritious foods. D. Administering Librium as ordered. Question 78 Answer. A. Monitoring his vital signs every hour. Question 78 Explanation. Pulse and blood pressure are usually elevated during withdrawal. Elevation may indicate impending delirium tremens. B. Client needs quiet, well-lighted, consistent and secure environment. Excessive stimulation can aggravate anxiety and cause illusions and hallucinations. C. Adequate nutrition with supplement of Vit. B. Should be ensured. D. Sedatives are used to relieve anxiety. Question 79. Another client is brought to the emergency room by friends who state that he took something an hour ago. He is actively hallucinating, agitated, with irritated nasal septum. A. Heroin. B. Cocaine. C. LS. D. Marijuana. Question 79 Answer. B. Cocaine. Question 79 Explanation. The manifestations indicate intoxication with cocaine, A CNS stimulant. A. Intoxication with heroin is manifested by euphoria, then impairment in judgment, attention, and the presence of papillary constriction. C. Intoxication with hallucinogen like LSD is manifested by grandiosity, hallucinations, synesthesia, and increase in vital signs. D. Intoxication with marijuana, a cannabinoid, is manifested by sensation of slowed time, conjunctival redness, social withdrawal, impaired judgment, and hallucinations. Question 80. A client is admitted with needle tracks on his arm, stuporous and with pinpoint pupil, will likely be managed with A. Naltrexone, Revia. B. Narcan, Naloxone. C. Disulfiram, Antabuse. D. Methadone, Dolafine. Question 80. Answer: B. Narcan, Naloxone. Question 80. Explanation: Narcan is a narcotic antagonist used to manage the CNS depression due to overdose with heroin. A. This is an opiate receptor blocker used to relieve the craving for heroin. C. Disulfiram is used as a deterrent in the use of alcohol. D. Methadone is used as a substitute in the withdrawal from heroin. Question 81. Situation: An old woman was brought for evaluation due to the hospital for evaluation due to increasing forgetfulness and limitations in daily function. The daughter revealed that the client used her toothbrush to comb her hair. She is manifesting A. Apraxia. B. Aphasia. C. Agnosia. D. Amnesia. Question 81. Answer: C. Agnosia. Question 81. Explanation: This is the inability to recognize objects. A. Apraxia is the inability to execute motor activities despite intact comprehension. B. Aphasia is the loss of ability to use or understand words. D. Amnesia is loss of memory. Question 82. She tearfully tells the nurse, "I can't take it when she accuses me of stealing her things." Which response by the nurse will be most therapeutic? A. Don't take it personally. Your mother does not mean it. B. Have you tried discussing this with your mother? C. This must be difficult for you and your mother. D. Next time ask your mother where her things were last seen. Question 82. Answer: C. This must be difficult for you and your mother. Question 82. Explanation: This reflecting the feeling of the daughter that shows empathy. And D. Giving advice does not encourage verbalization. B. This response does not encourage verbalization of feelings. Question 83. The primary nursing intervention in working with a client with moderate stage dementia is ensuring that the client A. receives adequate nutrition and hydration. B. will reminisce to decrease isolation. C. remains in a safe and secure environment. D. independently performs self-care. Question 83. Answer: C. remains in a safe and secure environment. Question 83. Explanation: Safety is a priority consideration as the client's cognitive ability deteriorates. A is appropriate interventions because the client's cognitive impairment can affect the client's ability to attend to his nutritional needs, but it is not the priority. B. Patient is allowed to reminisce but it is not the priority. D. The client in the moderate stage of Alzheimer's disease will have difficulty in performing activities independently. Question 84. She says to the nurse who offers her breakfast, "Oh no, I will wait for my husband. We will eat together." The therapeutic response by the nurse is A. Your husband is dead. Let me serve you your breakfast. B. I've told you several times that he is dead. It's time to eat. C. You're going to have to wait a long time. D. What made you say that your husband is alive? Question 84. Answer: Your husband is dead. Let me serve you your breakfast. Question 84. Explanation: The client should be reoriented to reality and be focused on the here and now. B. This is not a helpful approach because of the short-term memory of the client. C. This indicates a pompous response. D. The cognitive limitation of the client makes the client incapable of giving explanation. Question 85. Dementia, unlike delirium, is characterized by a. Slurred speech, b. Insidious onset, c. Clouding of consciousness, d. Sensory perceptual change. Question 85 answer, b. Insidious onset. Question 85 explanation. Dementia has a gradual onset and progressive deterioration. It causes pronounced memory and cognitive disturbances. A, C and D are all characteristics of delirium. Question 86. Situation. A 17-year-old gymnast is admitted to the hospital due to weight loss and dehydration secondary to starvation. Which of the following nursing diagnoses will be given priority for the client? A. Altered self-image. B. Fluid volume deficit. C. Altered nutrition less than body requirements. D. Altered family process. Question 86 answer, B. Fluid volume deficit. Question 86 explanation. Fluid volume deficit is the priority over altered nutrition. A. Since the situation indicates that the client is dehydrated. And D are psychosocial needs of a client with anorexia nervosa, but they are not the priority. Question 87. What is the best intervention to teach the client when she feels the need to starve? A. Allow her to starve to relieve her anxiety. B. Do a short-term exercise until the urge passes. C. Approach the nurse and talk out her feelings. D. Call her mother on the phone and tell her how she feels. Question 87 answer, C. Approach the nurse and talk out her feelings. Question 87 explanation. The client with anorexia nervosa uses starvation as a way of managing anxiety. Talking out feelings with a nurse is an adaptive coping. A. Starvation should not be encouraged. Physical safety is a priority. Without adequate nutrition, a life-threatening situation exists. B. The client with anorexia nervosa is preoccupied with losing weight due to disturbed body image. Limits should be set on attempts to lose more weight. D. The client may have a domineering mother which causes the client to feel ambivalent. The client will not discuss her feelings with her mother. Question 88. The client with anorexia nervosa is improving if A. She eats meals in the dining room. B. Weight gain. C. She attends ward activities. D. She has a more realistic self-concept. Question 88 answer, B. Weight gain. Question 88 explanation. Weight gain is the best indication of the client's improvement. The goal is for the client to gain 1-2 pounds per week. The client may purge after eating. C. Attending an activity does not indicate improvement in nutritional state. D. Body image is a factor in anorexia nervosa, but it is not an indicator for improvement. Question 89. The characteristic manifestation that will differentiate bulimia nervosa from anorexia nervosa is that bulimic individuals A. have episodic binge eating and purging. B. have repeated attempts to stabilize their weight. C. have peculiar food handling patterns. D. have threatened self-esteem. Question 89 answer, A. have episodic binge eating and purging. Question 89 explanation. Bulimia is characterized by binge eating, which is characterized by taking in a large amount of food over a short period of time. B and C are characteristics of a client with anorexia nervosa. D. Low esteem is noted in both eating disorders. Question 90. A nursing diagnosis for bulimia nervosa is powerlessness related to feeling not in control of eating habits. The goal for this problem is: A. Patient will learn problem-solving skills. B. Patient will have decreased symptoms of anxiety. C. Patient will perform self-care activities daily. D. Patient will verbalize how to set limits on others. Question 90 answer, A. patient will learn problem-solving skills. Question 90 explanation. If the client learns problem-solving skills, she will gain a sense of control over her life. B. Anxiety is caused by powerlessness. C. Performing self-care activities will not decrease one's powerlessness. D. Setting limits to control imposed by others is a necessary skill, but problem-solving skill is the priority. Question 91. In the management of bulimic patients, the following nursing interventions will promote a therapeutic relationship except A. Establish an atmosphere of trust. B. Discuss their eating behavior. C. Help patients identify feelings associated with binge-purge behavior. D. Teach patient about bulimia nervosa. Question 91. Answer: B. Discuss their eating behavior. Question 91. Explanation: the client is often ashamed of her eating behavior. Discussion should focus on feelings. A, C and D promote a therapeutic relationship. Question 92. Situation: a 35-year-old male has intense fear of riding an elevator. He claims, "as if I will die inside." This has affected his studies. The client is suffering from A. Agoraphobia. B. Social phobia. C. Claustrophobia. D. Xenophobia. Question 92. Answer: C. Claustrophobia. Question 92. Explanation: claustrophobia is fear of closed space. A. Agoraphobia is fear of open space or being a situation where escape is difficult. B. Social phobia is fear of performing in the presence of others in a way that will be humiliating or embarrassing. D. Xenophobia is fear of strangers. Question 93. Initial intervention for the client should be to A. Encourage to verbalize his fears as much as he wants. B. Assist him to find meaning to his feelings in relation to his past. C. Establish trust through a consistent approach. D. Accept her fears without criticizing. Question 93. Answer: D. Accept her fears without criticizing. Question 93. Explanation: the client cannot control her fears, although the client knows it's silly and can joke about it. A. Allow expression of the client's fears, but he should focus on other productive activities as well. B and C. These are not the initial interventions. Question 94. The nurse develops a countertransference reaction. This is evidenced by A. Revealing personal information to the client. B. Focusing on the feelings of the client. C. Confronting the client about discrepancies in verbal or nonverbal behavior. D. The client feels angry towards the nurse who resembles his mother. Question 94. Answer: A. Revealing personal information to the client. Question 94. Explanation: countertransference is an emotional reaction of the nurse on the client based on her unconscious needs and conflicts. B and C. These are therapeutic approaches. D. This is transference reaction, where a client has an emotional reaction towards the nurse based on her past. Question 95. Which is the desired outcome in conducting desensitization? A. The client verbalize his fears about the situation. B. The client will voluntarily attend group therapy in the social hall. C. The client will socialize with others willingly. D. The client will be able to overcome his disabling fear. Question 95. Answer: D. The client will be able to overcome his disabling fear. Question 95. Explanation: the client will overcome his disabling fear by gradual exposure to the feared object. A, B and C are not the desired outcome of desensitization. Question 96. Which of the following should be included in the health teachings among clients receiving Valium? A. Avoid taking CNS depressant like alcohol. B. There are no restrictions in activities. C. Limit fluid intake. D. Any beverage like coffee may be taken. Question 96. Answer: Avoid taking CNS depressant like alcohol. Question 96. Explanation: Valium is a CNS depressant. Taking it with other CNS depressants like alcohol potentiates its effect. B. The client should be taught to avoid activities that require alertness. C. Valium causes dry mouth, so the client must increase her fluid intake. D. Stimulants must not be taken by the client because it can decrease the effect of Valium. Question 97. Situation: a 20-year-old college student is admitted to the medical ward because of sudden onset of paralysis of both legs. Extensive examination revealed no physical basis for the complaint. The nurse plans intervention based on which correct statement about conversion disorder? A. The symptoms are conscious effort to control anxiety. B. The client will experience high level of anxiety in response to the paralysis. C. The conversion symptom has symbolic meaning to the client. D. A confrontational approach will be beneficial for the client. Question 97 Answer: C. The conversion symptom has symbolic meaning to the client. Question 97 Explanation: The client uses body symptoms to relieve anxiety. A. The condition occurs unconsciously. B. The client is not distressed by the lost or altered body function. D. The client should not be confronted by the underlying cause of his condition because this can aggravate the client's anxiety. Question 98. Nikki reveals that the boyfriend has been pressuring her to engage in premarital sex. The most therapeutic response by the nurse is: A. I can refer you to a spiritual counselor if you like. B. You shouldn't allow anyone to pressure you into sex. C. It sounds like this problem is related to your paralysis. D. How do you feel about being pressured into sex by your boyfriend? Question 98 Answer: D. How do you feel about being pressured into sex by your boyfriend? Question 98 Explanation: Focusing on expression of feelings is therapeutic. The central force of the client's condition is anxiety. A. This is not therapeutic because the nurse passes the responsibility to the counselor. B. Giving advice is not therapeutic. C. This is not therapeutic because it confronts the underlying cause. Question 99. Malingering is different from somatoform disorder because the former, A. has evidence of an organic basis. B. It is a deliberate effort to handle upsetting events. C. Gratification from the environment are obtained. D. Stress is expressed through physical symptoms. Question 99 Answer: B. It is a deliberate effort to handle upsetting events. Question 99 Explanation: Malingering is a conscious simulation of an illness while somatoform disorder occurs unconscious. A. Both disorders do not have an organic or structural basis. C. Both have primary gains. D. This is a characteristic of somatoform disorder. Question 100. Unlike psychophysiologic disorder, Linda may be best managed with A. Medical regimen. B. Milieu therapy. C. Stress management techniques. D. Psychotherapy. Question 100 Answer: C. Stress management techniques. Question 100 Explanation: Stress management techniques is the best management of somatoform disorder because the disorder is related to stress and it does not have a medical basis. A. This disorder is not supported by organic pathology, so no medical regimen is required. B and D. Milieu therapy and psychotherapy may be used as therapeutic modalities, but these are not the best. Question 101. Which nursing intervention is best for facilitating communication with a psychiatric client who speaks a foreign language? A. Rely on nonverbal communication. B. Select symbolic pictures as aids. C. Speak in universal phrases. D. Use the services of an interpreter. Question 101 Answer: D. Use the services of an interpreter. Question 101 Explanation: An interpreter will enable the nurse to better assess the client's problems and concerns. Nonverbal communication is important, however, for the nurse to fully determine the client's problems and concerns, the assistance of an interpreter is essential. The use of symbolic pictures and universal phrases may assist the nurse in understanding the basic needs of the client, however, these are insufficient to assess the client with a psychiatric problem. Question 102. The nurse explains to a mental health care technician that a client's obsessive-compulsive behaviors are related to unconscious conflict between id impulses and the superego, or conscience. On which of the following theories does the nurse base this statement? A. Behavioral theory. B. Cognitive theory. C. Interpersonal theory. D. Psychoanalytic theory. Question 102 Answer: D. Psychoanalytic theory. Question 102 Explanation: Psychoanalytic is based on Freud's beliefs regarding the importance of unconscious motivation for behavior and the role of the id and superego in opposition to each other. Behavioral cognitive and interpersonal theories do not emphasize unconscious conflicts as the basis for symptomatic behavior. Question 103. The nurse observes a client pacing in the hall. Which statement by the nurse may help the client recognize his anxiety? A. I guess you're worried about something, aren't you? B. Can I get you some medication to help calm you? C. Have you been pacing for a long time? D. I notice that you're pacing. How are you feeling? Question 103. Answer: D. I notice that you're pacing. How are you feeling? Question 103. Explanation: by acknowledging the observed behavior and asking the client to express his feelings, the nurse can best assist the client to become aware of his anxiety. In option A, the nurse is offering an interpretation that may or may not be accurate. The nurse is also asking a question that may be answered by a yes or no response, which is not therapeutic. In option B, the nurse is intervening before accurately assessing the problem. Option C, which also encourages a yes or no response, avoids focusing on the client's anxiety, which is the reason for his pacing. Question 104. A client with obsessive-compulsive disorder is hospitalized on an inpatient unit. Which nursing response is most therapeutic? A. Accepting the client's obsessive-compulsive behaviors. B. Challenging the client's obsessive-compulsive behaviors. C. Preventing the client's obsessive-compulsive behaviors. D. Rejecting the client's obsessive-compulsive behaviors. Question 104. Answer: accepting the client's obsessive-compulsive behaviors. Question 104. Explanation: a client with obsessive-compulsive behavior uses this behavior to decrease anxiety. Accepting this behavior as the client's attempt to feel secure is therapeutic. When a specific treatment plan is developed, other nursing responses may also be acceptable. The remaining answer choices will increase the client's anxiety and therefore are inappropriate. Question 105. A 45-year-old woman with a history of depression tells a nurse in her doctor's office that she has difficulty with sexual arousal and is fearful that her husband will have an affair. Which of the following factors would the nurse identify as least significant in contributing to the client's sexual difficulty? A. Education and work history. B. Medication used. C. Physical health status. D. Quality of spousal relationship. Question 105. Answer: A. Education and work history. Question 105. Explanation: education and work history would have the least significance in relation to the client's sexual problem. Age, health status, physical attributes and relationship issues have great influence on sexual expression. Question 106. Which nursing intervention is most appropriate for a client with anorexia nervosa during initial hospitalization on a behavioral therapy unit? A. Emphasize the importance of good nutrition to establish normal weight. B. Ignore the client's mealtime behavior and focus instead on issues of dependence and independence. C. Help establish a plan using privileges and restrictions based on compliance with refeeding. D. Teach the client information about the long-term physical consequence of anorexia. Question 106. Answer: C. Help establish a plan using privileges and restrictions based on compliance with refeeding. Question 106. Explanation: inpatient treatment of a client with anorexia usually focuses initially on establishing a plan for refeeding to combat the effects of self-induced starvation. Refeeding is accomplished through behavioral therapy, which uses a system of rewards and reinforcements to assist in establishing weight restoration. Emphasizing nutrition and teaching the client about the long-term physical consequences of anorexia may be appropriate at a later time in the treatment program. The nurse needs to assess the client's mealtime behavior continually to evaluate treatment effectiveness. Question 107. A nurse is evaluating therapy with the family of a client with anorexia nervosa. Which of the following would indicate that the therapy was successful? A. The parents reinforce increased decision-making by the client. B. The parents clearly verbalize their expectations for the client. C. The client verbalizes that family meals are now enjoyable. D. The client tells her parents about feelings of low self-esteem. Question 107. Answer: A. The parents reinforce increased decision-making by the client. Question 107 Explanation. One of the core issues concerning the family of a client with anorexia is control. The family's acceptance of the client's ability to make independent decisions is key to successful family intervention. Although the remaining options may occur during the process of therapy, they would not necessarily indicate a successful outcome. The central family issues of dependence and independence are not addressed in these responses. Question 108. The nurse is working with a client with a somatoform disorder. Which client outcome goal would the nurse most likely establish in this situation? A. The client will recognize signs and symptoms of physical illness. B. The client will cope with physical illness. C. The client will take prescribed medications. D. The client will express anxiety verbally rather than through physical symptoms. Question 108 Answer. D. The client will express anxiety verbally rather than through physical symptoms. Question 108 Explanation. The client with a somatoform disorder displaces anxiety onto physical symptoms. The ability to express anxiety verbally indicates a positive change toward improved health. The remaining responses do not indicate any positive change toward increased coping with anxiety. Question 109. Which method would a nurse use to determine a client's potential risk for suicide? A. Wait for the client to bring up the subject of suicide. B. Observe the client's behavior for cues of suicide ideation. C. Question the client directly about suicidal thoughts. D. Question the client about future plans. Question 109 Answer. C. Question the client directly about suicidal thoughts. Question 109 Explanation. Directly questioning a client about suicide is important to determine suicide risk. The client may not bring up this subject for several reasons, including guilt regarding suicide, wishing not to be discovered, and his lack of trust in staff. Behavioral cues are important, but direct questioning is essential to determine suicide risk. Indirect questions convey to the client that the nurse is not comfortable with the subject of suicide and, therefore, the client may be reluctant to discuss the topic. Question 110. A client with a bipolar disorder exhibits manic behavior. The nursing diagnosis is disturbed thought processes related to difficulty concentrating, secondary to flight of ideas. Which of the following outcome criteria would indicate improvement in the client? A. The client verbalizes feelings directly during treatment. B. The client verbalizes positive self-statement. C. The client speaks in coherent sentences. D. The client reports feelings calmer. Question 110 Answer. C. The client speaks in coherent sentences. Question 110 Explanation. A client exhibiting flight of ideas typically has a continuous speech flow and jumps from one topic to another. Speaking in coherent sentences is an indicator that the client's concentration has improved and his thoughts are no longer racing. The remaining options do not relate directly to the stated nursing diagnosis. Question 111. A client tells a nurse, "Everyone would be better off if I wasn't alive." Which nursing diagnosis would be made based on this statement? A. Disturbed thought processes. B. Ineffective coping. C. Risk for self-directed violence. D. Impaired social interaction. Question 111 Answer. C. Risk for self-directed violence. Question 111 Explanation. The nurse should take any nurse statements indicating suicidal thoughts seriously and further assess for other risk factors. The remaining diagnoses fail to address the seriousness of the client's statement. Question 112. Which information is most essential in the initial teaching session for the family of a young adult recently diagnosed with schizophrenia? A. Symptoms of this disease: imbalance in the brain. B. Genetic history is an important factor related to the development of schizophrenia. C. Schizophrenia is a serious disease affecting every aspect of a person's functioning. D. The distressing symptoms of this disorder can respond to treatment with medications. Question 112 Answer. D. The distressing symptoms of this disorder can respond to treatment with medications. Question 112 Explanation. This statement provides accurate information and an element of hope for the family of a schizophrenic client. Although the remaining statements are true, they do not provide the empathic response the family needs after just learning about the diagnosis. These facts can become part of the ongoing teaching. Question 113. A nurse is working with a client who has schizophrenia, paranoid type. Which of the following outcomes related to the client's delusional perceptions would the nurse establish? A. The client will demonstrate realistic interpretation of daily events in the unit. B. The client will perform daily hygiene and grooming without assistance. C. The client will take prescribed medications without difficulty. D. The client will participate in unit activities. Question 113. Answer: A. The client will demonstrate realistic interpretation of daily events in the unit. Question 113. Explanation: A client with schizophrenia, paranoid type, has distorted perceptions and views people, institutions, and aspects of the environment as plotting against him. The desired outcome for someone with delusional perceptions would be to have a realistic interpretation of daily events. The client with a distorted perception of the environment would not necessarily have impairments affecting hygiene and grooming skills. Although taking medications and participating in unit activities may be appropriate outcomes for nursing intervention, these responses are not related to client perceptions. Question 114. A client with bipolar disorder, manic type, exhibits extreme excitement, delusional thinking, and command hallucinations. Which of the following is the priority nursing diagnosis? A. Anxiety. B. Impaired social interaction. C. Disturbed sensory perceptual alteration, auditory. D. Risk for other directed violence. Question 114. Answer: D. Risk for other directed violence. Question 114. Explanation: A client with these symptoms would have poor impulse control and would therefore be prone to acting out behavior that may be harmful to either himself or others. All of the remaining nursing diagnoses may apply to the client with mania, however, the priority diagnosis would be risk for violence. Question 115. A client who abuses alcohol and cocaine tells a nurse that he only uses substances because of his stressful marriage and difficult job. Which defense mechanisms is this client using? A. Displacement. B. Projection. C. Rationalization. D. Sublimation. Question 115. Answer: C. Rationalization. Question 115. Explanation: Rationalization is the defense mechanism that involves offering excuses for maladaptive behavior. The client is defending his substance abuse by providing reasons related to life stressors. This is a common defense mechanism used by clients with substance abuse problems. None of the remaining defense mechanisms involves making excuses for behaviors. Question 116. An 11-year-old child diagnosed with conduct disorder is admitted to the psychiatric unit for treatment. Which of the following behaviors would the nurse assess? A. Restlessness, short attention span, hyperactivity. B. Physical aggressiveness, low stress tolerance, disregard for the rights of others. C. Deterioration in social functioning, excessive anxiety and worry, bizarre behavior. D. Sadness, poor appetite and sleeplessness, loss of interest in activities. Question 116. Answer: B. Physical aggressiveness, low stress tolerance, disregard for the rights of others. Question 116. Explanation: Physical aggressiveness, low stress tolerance, and a disregard for the rights of others are common behaviors in clients with conduct disorders. Restlessness, short attention span, and hyperactivity are typical behaviors in a client with attention deficit hyperactivity disorder. Deterioration in social functioning, excessive anxiety and worry and bizarre behaviors are typical in schizophrenic disorders. Sadness, poor appetite, sleeplessness, and loss of interest in activities are behaviors commonly seen in depressive disorders. Question 117. The nurse understands that if a client continues to be dependent on heroin throughout her pregnancy, her baby will be at high risk for A. Mental retardation. B. Heroin dependence. C. Addiction in adulthood. D. Psychological disturbances. Question 117 Answer: B. Heroin dependence. Question 117 Explanation: Babies born to heroin-dependent women are also heroin-dependent and need to go through withdrawal. There is no evidence to support any of the remaining answer choices. Question 118. The emergency department nurse is assigned to provide care for a victim of a sexual assault. When following legal and agency guidelines, which intervention is most important? A. Determine the assailant's identity. B. Preserve the client's privacy. C. Identify the extent of injury. D. Ensure an unbroken chain of evidence. Question 118 Answer: D. Ensure an unbroken chain of evidence. Question 118 Explanation: Establishing an unbroken chain of evidence is essential in order to ensure that the prosecution of the perpetrator can occur. The nurse will also need to preserve the client's privacy and identify the extent of injury. However, it is essential that the nurse follow legal and agency guidelines for preserving evidence. Identifying the assailant is the job of law enforcement, not the nurse. Question 119. Which factor is least important in the decision regarding whether a victim of family violence can safely remain in the home? A. The availability of appropriate community shelters. B. The non-abusing caretaker's ability to intervene on the client's behalf. C. The client's possible response to relocation. D. The family's socioeconomic status. Question 119 Answer: D. The family's socioeconomic status. Question 119 Explanation: Socioeconomic status is not a reliable predictor of abuse in the home, so it would be the least important consideration in deciding issues of safety for the victim of family violence. The availability of appropriate community shelters and the ability of the non-abusing caretaker to intervene on the client's behalf are important factors when making safety decisions. The client's response to possible relocation, if the client is a competent adult, would be the most important factor to consider. Feelings of empowerment and being treated as a competent person can help a client feel less like a victim. Question 120. The nurse would expect a client with early Alzheimer's disease to have problems with A. Balancing a checkbook. B. Self-care measures. C. Relating to family members. D. Remembering his own name. Question 120 Answer: A. Balancing a checkbook. Question 120 Explanation: In the early stage of Alzheimer's disease, complex tasks, such as balancing a checkbook, would be the first cognitive deficit to occur. The loss of self-care ability, problems with relating to family members, and difficulty remembering one's own name are all areas of cognitive decline that occur later in the disease process. Question 121. Which nursing intervention is most appropriate for a client with Alzheimer's disease who has frequent episodes? Emotional lability. A. Attempt humor to alter the client mood. B. Explore reasons for the client's altered mood. C. Reduce environmental stimuli to redirect the client's attention. D. Use logic to point out reality aspects. Question 121 Answer: C. Reduce environmental stimuli to redirect the client's attention. Question 121 Explanation: The client with Alzheimer's disease can have frequent episode of labile mood, which can best be handled by decreasing a stimulating environment and redirecting the client's attention. An overstimulating environment may cause the labile mood, which will be difficult for the client to understand. The client with Alzheimer's disease loses the cognitive ability to respond to either humor or logic. The client lacks any insight into his or her own behavior and therefore will be unaware of any causative factors. Question 122. Which neurotransmitter has been implicated in the development of Alzheimer's disease? A. Acetylcholine. B. Dopamine. C. Epinephrine. D. Serotonin. Question 122 Answer: Acetylcholine. Question 122 Explanation: A relative deficiency of acetylcholine is associated with this disorder. The drugs used in the early stages of Alzheimer's disease will act to increase available acetylcholine in the brain. The remaining neurotransmitters have not been implicated in Alzheimer's disease. Question 123. Which factors are most essential for the nurse to assess when providing crisis intervention for a client? A. The client's communication and coping skills. B. The client's anxiety level and ability to express feelings. C. The client's perception of the triggering event and availability of situational supports. D. The client's use of reality testing and level of depression. Question 123. Answer: C. The client's perception of the triggering event and availability of situational supports. Question 123. Explanation: the most important factors to determine in these situations are the client's perception of the crisis event and the availability of support, including family and friends, to provide basic needs. Although the nurse should assess the other factors, they are not as essential as determining why the client considers this a crisis and whether he can meet his present needs. Question 124. The nurse considers a client's response to crisis intervention successful if the client: A. changes coping skills and behavioral patterns. B. develops insight into reasons why the crisis occurred. C. learns to relate better to others. D. returns to his previous level of functioning. Question 124. Answer: D. returns to his previous level of functioning. Question 124. Explanation: crisis intervention is based on the idea that a crisis is a disturbance in homeostasis, steady state. The goal is to help the client return to a previous level of equilibrium in functioning. The remaining answer choices are not considered the primary outcome of crisis intervention, although they may occur as a side benefit. Question 125. 2 nurses are co-leading group therapy for 7 clients in the psychiatric unit. The leaders observe that the group members are anxious and look to the leaders for answers. Which phase of development is this group in? A. conflict resolution phase. B. initiation phase. C. working phase. D. termination phase. Question 125. Answer: B. initiation phase. Question 125. Explanation: increased anxiety and uncertainty characterize the initiation phase in group therapy. Group members are more self-reliant during the working and termination phases. Question 126. Group members have worked very hard, and the nurse reminds them that termination is approaching. Termination is considered successful if group members: A. decide to continue. B. elevate group progress. C. focus on positive experience. D. stop pretending prior to termination. Question 126. Answer: A. decide to continue. Question 126. Explanation: as the group progresses into the working phase, group members assume more responsibility for the group. The leader becomes more of a facilitator. Comments about behavior in a group are indicators that the group is active and involved. The remaining answer choices would indicate the group progress has not advanced to the working phase. Question 127. The nurse is teaching a group of clients about the mood-stabilizing medications lithium carbonate. Which medications should she instruct the clients to avoid because of the increased risk of lithium toxicity? A. antacids. B. antibiotics. C. diuretics. D. hypoglycemic agents. Question 127. Answer: C. diuretics. Question 127. Explanation: the use of diuretics would cause sodium and water excretion, which would increase the risk of lithium toxicity. Clients taking lithium carbonate should be taught to increase their fluid intake and to maintain normal intake of sodium. Concurrent use of any of the remaining medications will not increase the risk of lithium toxicity. Question 128. When providing family therapy, the nurse analyzes the functioning of healthy family systems. Which situations would not increase stress on a healthy family system? An adolescent's going away to college. B. the birth of a child. C. the death of a grandparent. D. parental disagreement. Question 128. Answer: D. parental disagreement. Question 128. Explanation: In a functional family, parents typically do not agree on all issues and problems. Open discussion of thoughts and feeling is healthy, and parental disagreement should not cause system stress. The remaining answer choices are life transitions that are expected to increase family stress. Question 129. A client taking the monoamine oxidase inhibitor, MA, antidepressant isocarbooxacid, Marplan, is instructed by the nurse to avoid which foods and beverages? A. Aged cheese and red wine. B. Milk and green, leaf vegetables. C. Carbonated beverages and tomato products. D. Lean red meats and fruit juices. Question 129. Answer: A. Aged cheese and red wine. Question 129. Explanation: Aged cheese and red wines contain the substance tyramine which, when taken with an MA, can precipitate a hypertensive crisis. The other foods and beverages do not contain significant amounts of tyramine and, therefore, are not restricted. Question 130. Prior to administering chlorpromazine, thorazine, to an agitated client, the nurse should: A. Assess skin color and sclera. B. Assess the radial pulse. C. Take the client's blood pressure. D. Ask the client to void. Question 130. Answer: C. Take the client's blood pressure. Question 130. Explanation: Because chlorpromazine, thorazine, can cause a significant hypotensive effect, and possible client injury, the nurse must assess the client's blood pressure, lying, sitting, and standing, before administering this drug. If the client had taken the drug previously, the nurse would also need to assess the skin color and sclera for signs of jaundice, a possible drug side effect. However, based on the information given here, there is no evidence that the client has received chlorpromazine before. Although the drug can cause urine retention, asking the client to avoid will not alter this anticholinergic effect. Question 131. The nurse understands that electroconvulsive therapy is primarily used in psychiatric care for the treatment of A. Anxiety disorders. B. Depression. C. Mania. D. Schizophrenia. Question 131. Answer: B. Depression. Question 131. Explanation: The onset of action of the SSRI antidepressant paroxetine occurs around 3 to 4 weeks after drug therapy begins. Therefore, a client will seldom notice improvement before this time. Continuing to take the drug is important for this client. Question 132. A client taking the moifinilzin, Nardil, tells the nurse that he routinely takes all of the medications listed below. Which medication would cause the nurse to express concern and therefore initiate further teaching? A. Acetaminophen, Tylenol. B. Diphenhydramine, Benadryl. C. Furosemide, Lasix. D. Isosorbide dinitrate, Isortil. Question 132. Answer: B. Diphenhydramine, Benadryl. Question 132. Explanation: Over-the-counter medications used for allergies and cold symptoms are contraindicated because they will increase the symptomatic effects of MAs, possibly causing a hypertensive crisis. None of the remaining medications will increase the symptomatic response and, therefore, are not contraindicated. Question 133. The nurse is administering a psychotropic drug to an elderly client who has history of benign prostatic hypertrophy. It is most important for the nurse to teach this client to: A. Add fiber to his diet. B. Exercise on a regular basis. C. Report incomplete bladder emptying. D. Take the prescribed dose at bedtime. Question 133. Answer: C. Report incomplete bladder emptying. Question 133. Explanation: Urinary retention is a common anticholinergic side effect of psychotic medications, and the client with benign prostatic hypertrophy would have increased risk for this problem. Adding fiber to one's diet and exercising regularly are measures to counteract another anticholinergic effect, constipation. Depending on the specific medication and how it is prescribed, taking the medication at night may or may not be important. However, it would have nothing to do with urinary retention in this client. Question 134. The nurse correctly teaches a client taking the benzodiazepine oxazepam, Serax, to avoid excessive intake of A. cheese, B. coffee, C. sugar, D. shellfish. Question 134 Answer: B. coffee. Question 134 Explanation: Coffee contains caffeine, which has a stimulating effect on the central nervous system that will counteract the effect of the anti-anxiety medication oxazepam. None of the remaining foods is contraindicated. Question 135. The nurse provides a referral to Alcoholics Anonymous to a client who describes a 20-year history of alcohol abuse. The primary function of this group is to A. Encourage the use of a 12-step program. B. Help members maintain sobriety. C. Provide fellowship among members. D. Teach positive coping mechanisms. Question 135 Answer: B. Help members maintain sobriety. Question 135 Explanation: The primary purpose of Alcoholics Anonymous is to help members achieve and maintain sobriety. Although each of the remaining answer choices may be an outcome of attendance at Alcoholics Anonymous, the primary purpose is directed toward sobriety of members. Question 136. Which client outcome is most appropriately achieved in a community approach setting in psychiatric nursing? A. The client performs activities of daily living and learns about crafts. B. The client is able to prevent aggressive behavior and monitors his use of medications. C. The client demonstrates self-reliance and social adaptation. D. The client experiences anxiety relief and learns about his symptoms. Question 136 Answer: C. The client demonstrates self-reliance and social adaptation. Question 136 Explanation: A therapeutic community is designed to help individuals assume responsibility for themselves, to learn how to respect and communicate with others, and to interact in a positive manner. The remaining answer choices may be outcomes of psychiatric treatment, but the use of a therapeutic community approach is concerned with promotion of self-reliance and cooperative adaptation to being with others. Question 137. A client with panic disorder experiences an acute attack while the nurse is completing an admission assessment. List the following interventions according to their level of priority. A. Remain with the client. B. Encourage physical activity. C. Encourage low, deep breathing. D. Reduce external stimuli. E. Teach coping measures. A. ABCD. E. B. ADBC. E. C. ACDB. E. D. ADCB. Question 137 Answer: D. ADCB. Question 137 Explanation: The nurse should remain with the client to provide support and promote safety. Reducing external stimuli, including dimming lights and avoiding crowded areas, will help decrease anxiety. Encouraging the client to use slow, deep breathing will help promote the body's relaxation response, thereby interrupting stimulation from the autonomic nervous system. Encouraging physical activity will help him to release energy resulting from the heightened anxiety state. This should be done only after the client has brought his breathing under control. Teaching coping measures will help the client learn to handle anxiety, however, this can only be accomplished when the client's panic has dissipated and he is better able to focus. Question 138. The doctor has prescribed haloperidol, Haldol 2.5 mg. IM for an agitated client. The medication is labeled haloperidol 10 mg/2 ml. The nurse prepares the correct dose by drawing up how many milliliters in the syringe. A. 0.3. B. 0.4. C. 0.5. D. 0.6. Question 138 Answer: C. 0.5. Question 138 Explanation: Set up the problem as follows: 2.5 mg/10 mg equals x ml/2 ml x equals 0.5 ml. Question 139. The nurse enters the room of a client with a cognitive impairment disorder and asks what day of the week it is, what the date, month, and year are, and where the client is. The nurse is attempting to assess A. Confabulation, B. Delirium, C. Orientation, D. Perseveration. Question 139 Answer, C. Orientation. Question 139 Explanation. The initial, most basic assessment of a client with cognitive impairment involves determining his level of orientation, awareness of time, place, and person. The nurse may also assess for confabulation and perseveration in a client with cognitive impairment, but the questions in this situation would not elicit the symptom response. Delirium is a type of cognitive impairment, however, other symptoms are necessary to establish this diagnosis. Question 140. Which of the following will the nurse use when communicating with a client who has a cognitive impairment? A. Complete explanations with multiple details. B. Picture or gestures instead of words. C. Stimulating words and phrases to capture the client's attention. D. Short words and simple sentences. Question 140 Answer, D. Short words and simple sentences. Question 140 Explanation. Short words and simple sentence minimize client confusion and enhance communication. Complete explanations with multiple details and stimulating words and phrases would increase confusion in a client with short attention span and difficulty with comprehension. Although pictures and gestures may be helpful, they would not substitute for verbal communication. Question 141. A 75-year-old client has dementia of the Alzheimer's type and confabulates. The nurse understands that this client, A. denies confusion by being jovial, B. pretends to be someone else, C. rationalizes various behaviors, D. fills in memory gaps with fantasy. Question 141 Answer, D. fills in memory gaps with fantasy. Question 141 Explanation. Confabulation is a communication device used by patients with dementia to compensate for memory gaps. The remaining answer choices are incorrect. Question 142. An elderly client with Alzheimer's disease becomes agitated and combative when a nurse approaches to help with morning care. The most appropriate nursing intervention in this situation would be to A. Tell the client family that it is time to get dressed. B. Obtain assistance to restrain the client for safety. C. Remain calm and talk quietly to the client. D. Call the doctor and request an order for sedation. Question 142 Answer, C. Remain calm and talk quietly to the client. Question 142 Explanation. Maintaining a calm approach when intervening with an agitated client is extremely important. Telling the client firmly that it is time to get dressed may increase his agitation, especially if the nurse touches him. Restraints are a last resort to ensure client safety and are inappropriate in this situation. Sedation should be avoided, if possible, because it will interfere with CNS functioning and may contribute to the client's confusion. Question 143. In clients with a cognitive impairment disorder, the phenomenon of increased confusion in the early evening hours is called A. aphasia, B. agnosia, C. sundowning, D. confabulation. Question 143 Answer, C. sundowning. Question 143 Explanation. Sundowning is a common phenomenon that occurs after daylight hours in a client with a cognitive impairment disorder. The other options are incorrect responses, although all may be seen in this client. Question 144. Which of the following outcome criteria is appropriate for the client with dementia? A. The client will return to an adequate level of self-functioning. B. The client will learn new coping mechanisms to handle anxiety. C. The client will seek out resources in the community for support. D. The client will follow an establishing schedule for activities of daily living. Question 144 Answer, D. The client will follow an establishing schedule for activities of daily living. Question 144 Explanation. Following established activity schedules is a realistic expectation for clients with dementia. All of the remaining outcome statements require a higher level of cognitive ability than can be realistically expected of clients with this disorder. Question 145. The school guidance counselor refers a family with an 8-year-old child to the mental health clinic because of the child's frequent fighting in school and truancy. Which of the following data would be a priority to the nurse doing the initial family assessment? A. The child's performance in school. B. Family education and work history. C. The family's perception of the current problem. D. The teacher's attempts to solve the problem. Question 145. Answer: C. The family's perception of the current problem. Question 145. Explanation: the family's perception of the problem is essential because change in any one part of a family system affects all other parts and the system as a whole. Each member of the family has been affected by the current problems related to the school system, and the nurse would be interested in the data. The child's performance in school and the teacher's attempts to solve the problem are relevant and may be assessed. However, priority would be given to the family's perception of the problem. The family education and work history may be relevant, but are not a priority. Question 146. The parents of a young man with schizophrenia express feelings of responsibility and guilt for their son's problems. How can the nurse best educate the family? A. Acknowledge the parent's responsibility. B. Explain the biological nature of schizophrenia. C. Refer the family to a support group. D. Teach the parents various ways they must change. Question 146. Answer: B. Explain the biological nature of schizophrenia. Question 146. Explanation: the parents are feeling responsible, and this inappropriate self-blame can be limited by supplying them with the facts about the biologic basis of schizophrenia. Acknowledging the patient's responsibility is neither accurate nor helpful to the parents and would only reinforce their feelings of guilt. Support groups are useful, however. The nurse needs to handle the parent's self-blame directly instead of making a referral for this problem. Teaching the parents various ways to change would reinforce the parental assumption of blame. Although parents can learn about schizophrenia and what is helpful and not helpful, the approach suggested in this option implies the parent's behavior is at fault. Question 147. The nurse collecting family assessment data asks: who is in your family and where do they live? Which of the following is the nurse attempting to identify? A. Boundaries. B. Ethnicity. C. Relationships. D. Triangles. Question 147. Answer: A. Boundaries. Question 147. Explanation: family boundaries are parameters that define who is inside and outside the system. The best method of obtaining this information is asking the family directly who they consider to be members. The question asked by the nurse would not elicit information about the family's ethnicity or culture, nor does it address the nature of the family relationship. Question 148. According to the family systems theory, which of the following best describes the process of differentiation? A. Cooperative action among members of the family. B. Development of autonomy within the family. C. Incongruent messages wherein the recipient is a victim. D. Maintenance of system continuity or equilibrium. Question 148. Answer: B. Development of autonomy within the family. Question 148. Explanation: differentiation is the process of becoming an individual developing autonomy while staying in contact with the family system. Cooperative action among family members does not refer to differentiation, although individuals who have a high level of differentiation would be able to accomplish cooperative action. Incongruent messages in which the recipient is a victim describe double-bind communication. Maintenance of system continuity or equilibrium is homeostasis. Question 149. The nurse is interacting with a family consisting of a mother, a father, and a hospitalized adolescent who has a diagnosis of alcohol abuse. The nurse analyzes the situation and agrees with the adolescent's view about family rules. Which intervention is most appropriate? A. The nurse should align with the adolescent, who is the family scapegoat. B. The nurse should encourage the parents to adopt more realistic rules. C. The nurse should encourage the adolescent to comply with parental rules. D. The nurse should remain objective and encourage mutual negotiation of issues. Question 149. Answer: D. The nurse should remain objective and encourage mutual negotiation of issues. Question 149. Explanation: the nurse who wishes to be helpful to the entire family must remain neutral. Taking sides in a conflict situation in a family will not encourage negotiation, which is important for problem resolution. If the nurse aligned with the adolescent, then the nurse would be blaming the parents for the child's current problem. This would not help the family's situation. Learning to negotiate conflict is a function of a healthy family. Encouraging the parents to adopt more realistic rules or the adolescent to comply with parental rules does not give the family an opportunity to try to resolve problems on their own. Question 150. A 16-year-old girl has returned home following hospitalization for treatment of anorexia nervosa. The parents tell the family nurse performing a home visit that their child has always done everything to please them and they cannot understand her current stubbornness about eating. The nurse analyzes the family situation and determines it is characteristic of which relationship style? A. Differentiation. B. Disengagement. C. Enmeshment. D. Scapegoating. Question 150. Answer: C. Enmeshment. Question 150. Explanation: enmeshment is a fusion or over-involvement among family members whereby the expectation exists that all members think and act alike. The child who always acts to please her parents is an example of how enmeshment affects development in many cases. A child who develops anorexia nervosa exerts control only in the area of eating behavior. The remaining options are not appropriate to the situation described. Question 151. A man is admitted to the nursing care unit with a diagnosis of cirrhosis. He has a long history of alcohol dependence. During the late evening following his admission, he becomes increasingly disoriented and agitated. Which of the following would the client be least likely to experience? A. Diaphoresis and tremors. B. Increased blood pressure and heart rate. C. Illusions. D. Delusions of grandeur. Question 151. Answer: D. Delusions of grandeur. Question 151. Explanation: diaphoresis and tremors occur in the first phase of alcohol withdrawal. The blood pressure and heart rate increase in the first phase of alcohol withdrawal. Illusions are common in persons withdrawing from alcohol. Illusions occur most often in dim artificial lighting where the environment is not perceived accurately. Delusions of grandeur are symptomatic of manic clients, not clients withdrawing from alcohol. The symptoms and history of alcohol abuse suggest this client is in alcohol withdrawal. Question 152. Mr. Peterson, 35, is admitted for bipolar illness, manic phase, after assaulting his landlord in an argument over Mr. Peterson is staying up all night playing loud music. Mr. Peterson is hyperactive, intrusive, and has rapid, pressured speech. He has not slept in 3 days and appears thin and disheveled. Which of the following is the most essential nursing action at this time? A. Providing a meal and beverage for Mr. Peterson to eat in the dining room. B. Providing linens and toiletries for Mr. Peterson to attend to his hygiene. C. Consulting with the psychiatrist to order a hypnotic to promote sleep. D. Providing for client safety by limiting his privileges. Question 152. Answer: D. Providing for client safety by limiting his privileges. Question 152. Explanation: food and fluids are necessary. However, Mr. Peterson's hyperactivity does not allow him to sit quietly to eat. Finger foods on the run will provide needed nourishment. When hyperactivity decreases, then approach Mr. Peterson's. Regarding hygiene and grooming needs, medications will be ordered. However, a thorough evaluation must be done first. Mr. Peterson has been assaultive with the landlord and it is reasonable to expect that he may be with peers and staff. His mental illness produces a hyperactive state and poor judgment and impulse control. External controls such as limiting of unit privileges will assist in feelings of security and safety. Question 153. Which of the following would best indicate to the nurse that a depressed client is improving? A. Reduced levels of anxiety. B. Changes in vegetative signs. C. Compliance with medications. D. Requests to talk to the nurse. Question 153. Answer: B. Changes in vegetative signs. Question 153. Explanation: reduced levels of anxiety do not indicate an improvement in depressive symptoms. Vegetative signs such as insomnia, anorexia, psychomotor retardation, constipation, diminished libido, and poor concentration are biological responses to depression. Improvement in these signs indicates a lifting of the depression. Compliance with medications does not indicate improvement in depression. Requests to talk to the nurse vary. Requests may show trust in the nurse but are not a sign that depression has diminished. Question 154. An elderly man is admitted to the hospital. He was alert and oriented during the admission interview. However, his family states that he becomes disruptive and disoriented around dinner time. One night he was shouting furiously and didn't know where he was. He was sedated and the next morning he was fine. At dinner time the disruptive behavior returned. The client is diagnosed as having sundown syndrome. The client's son asks the nurse what causes sundown syndrome. The nurse's best response is that it is attributed to A. An underlying depression. B. Inadequate cerebral flow. C. Changes in the sensory environment. D. Fluctuating levels of oxygen exchange. Question 154. Answer: C. Changes in the sensory environment. Question 154. Explanation: an underlying depression does not cause sundown syndrome. There is not sufficient evidence to suggest he has inadequate cerebral blood flow. Because the confusion occurs at sundown, the cause is probably changes in the sensory environment. Sundown syndrome is related to environmental and sensory abnormalities that lead to acute confusion. Fluctuating levels of oxygen exchange do not cause sundown syndrome. Question 155. The nurse is discussing electroconvulsive therapy, ECT, with a client who asks how long it will be before she feels better. The nurse explains that the beneficial effects of ECT usually occur within A. 1 week. B. 3 weeks. C. 4 weeks. D. 6 weeks. Question 155. Answer: A 1 week. Question 155. Explanation: beneficial effects of ECT usually are evident after the first several treatments. Since treatments are administered at intervals of 48 hours, these effects are apparent after 1 week of therapy. Beneficial effects of ECT therapy are usually seen before 3 weeks. It takes 3 to 4 weeks for tricyclic antidepressants to take effect. Beneficial effects of ECT therapy are usually seen before 4 weeks. It takes 3 to 4 weeks for tricyclic antidepressants to take effect. Beneficial effects of ECT therapy are usually seen after the first few treatments. Question 156. The nurse is assessing a 17-year-old female who is admitted to the eating disorders unit with a history of weight fluctuation, abdominal pain, teeth erosion, receding gums, and bad breath. She states that her health has been a problem but there are no other concerns in her life. Which of the following assessments will be the least useful as the nurse develops the care plan? A. Information regarding recent mood changes. B. Family functioning using a genogram. C. Ability to socialize with peers. D. Whether she has a sexual relationship with a boyfriend. Question 156. Answer: D. Whether she has a sexual relationship with a boyfriend. Question 156. Explanation: information about mood changes is important to assess, as bulimia is often associated with affective disorders. Family functioning is the most essential point to assess, as it reveals if binge eating is triggered by conflict within the family. Information about ability to socialize with peers is important to assess, as it is possible the problem initiated with peer relationships. It is inappropriate to ask about her sexual relationships. Question 157. A 34-year-old woman is admitted for treatment of depression. Which of these symptoms would the nurse be least likely to find in the initial assessment? A. Inability to make decisions. B. Feelings of hopelessness. C. Family history of depression. D. Increased interest in sex. Question 157. Answer: D. Increased interest in sex. Question 157. Explanation: indecisiveness and fear of being wrong are common in depression. Depression creates feelings that nothing will ever improve. The risk of depression is increased when there is a family history. Interest in sex is markedly decreased in depression. Question 158. The nurse is planning care for a client who has a phobic disorder manifested by a fear of elevators. Which goal would need to be accomplished first? The client: A. Demonstrates the relaxation response when asked. B. Verbalizes the underlying cause of the disorder. C. Rides the elevator in the company of the nurse. D. Role plays the use of an elevator. Question 158. Answer: A. Demonstrates the relaxation response when asked. Question 158. Explanation: the ability to use relaxation is basic to treatment of phobia. Clients with phobias are resistant to insight therapy. Riding the elevator accompanied by the nurse is an appropriate long-term goal. Role-playing may be appropriate after the client has learned relaxation. Question 159. A teenage female is admitted with the diagnosis of anorexia nervosa. Upon admission, the nurse finds a bottle of assorted pills in the client's drawer. The client tells the nurse that they are antacids for stomach pains. The best response by the nurse would be: A. These pills aren't antacids since they are all different. B. Some teenagers use pills to lose weight. C. Tell me about your week prior to being admitted. D. Are you taking pills to change your weight? Question 159. Answer: C. Tell me about your week prior to being admitted. Question 159. Explanation: this is an open-ended question which is non-judgmental and allows for further discussion. The topic is also non-threatening yet will give the nurse insight into the client's view of events leading up to admission. It is the only option that is client-centered. The other options focus on the pills. Question 160. A mother with a Roman Catholic belief has given birth in an ambulance on the way to the hospital. The neonate is in very critical condition with little expectation of surviving the trip to the hospital. Which of these requests should the nurse in the ambulance anticipate and be prepared to do? A. The refusal of any treatment for self and the neonate until she talks to a reader. B. The placement of a rosary necklace around the neonate's neck and not to remove it unless absolutely necessary. C. Arrange for a church elder to be at the emergency department when the ambulance arrives so a laying on hands can be done. D. Pour fluid over the forehead backwards towards the back of the head and say, I baptize you in the name of the Father, the Son and the Holy Spirit. Amen. Question 160. Answer: D. Pour fluid over the forehead backwards towards the back of the head and say, I baptize you in the name of the Father, the Son and the Holy Spirit. Amen. Question 160. Explanation: infant baptism is mandatory in the Roman Catholic belief, especially if a neonate is not expected to live. Anyone may perform this if an infant or child is gravely ill. Option A refers to the Christian Science belief. Option B is a belief of Russian Orthodoxy. Mormons believe of divine healing with the laying on of hands, as represented in option C. Question 161. Which statement by the client during the initial assessment in the emergency department is most indicative for suspected domestic violence? A. I am determined to leave my house in a week. B. No one else in the family has been treated like this. C. I have only been married for 2 months. D. I have tried leaving, but have always gone back. Question 161 Answer, D. I have tried leaving, but have always gone back. Question 161 Explanation, victims develop a high tolerance for abuse. They blame themselves for being victimized. All members in the family suffer from the effects of abuse, even if they are not the actual victims. For these reasons, victims often have an extensive history of abuse and struggle for a long time before they can leave permanently. Question 162. Which of these statements by the nurse reflects the best use of therapeutic interaction techniques? A. You look upset. Would you like to talk about it? B. I'd like to know more about your family. Tell me about them. C. I understand that you lost your partner. I don't think I could go on if that happened to me. D. You look very sad. How long have you been this way? Question 162 Answer, you look upset. Would you like to talk about it? Question 162 Explanation, giving broad opening statements and making observations are examples of therapeutic communication. The other options are too specific or focused to be therapeutic. Question 163. When planning the therapeutic milieu, it is most important to select group activities which A. Match the client's preferences. B. Are consistent with client's skills. C. Achieve client's therapeutic goals. D. Build skills of group participation. Question 163 Answer, C. Achieve client's therapeutic goals. Question 163 Explanation, activity groups are used to enhance the therapeutic milieu and to meet the clinical and social needs of clients, for example, to minimize withdrawal and regression, to develop self-care skills, etc. Question 164. A client was admitted to the psychiatric unit for severe depression. After several days, the client continues to withdraw from other clients. Which of the following would be the most appropriate statement by the nurse to promote interaction with other clients? A. Your doctor thinks it's good for you to spend time with others. B. It is important for you to participate in group activities. C. Painting this picture will help you feel better. D. Come play Chinese checkers with Jerry and me. Question 164 Answer, D. Come play Chinese checkers with Jerry and me. Question 164 Explanation, this gradually engages the client in interactions with others and uses positive behavioral expectation. Question 165, the nurse can best ensure the safety of a demented client who wanders from the room by A. Repeatedly reminding the client of time and place. B. Explaining the risks of becoming lost. C. Using soft restraints. D. Attaching a WanderGuard sensor band to the client's wrist. Question 165 Answer, D. Attaching a WanderGuard sensor band to the client's wrist. Question 165 Explanation, this type of identification band easily tracks the client's movements and ensures safety while wandering on the unit. Question 166. A client with paranoid thoughts refuses to eat because he believes the food is poisoned. The most appropriate initial action is to A. Taste the food in the client's presence. B. Suggest that food be brought from home. C. Simply state the food is not poisoned. D. Inform the client he will be tube-fed if he does not eat. Question 166 Answer, C. Simply state the food is not poisoned. Question 166 Explanation, this actions presents reality. Question 167, the nurse is caring for a severely depressed client who has just been admitted to the in-client psychiatric unit. Which of the following is a priority of care? A. Nutrition. B. Elimination. C. Rest. D. Safety. Question 167 Answer, D. Safety. Question 167 Explanation, safety is a priority of care for the depressed client. Precautions to prevent suicide must be a part of the plan. Question 168, a nurse is teaching a stress management program for client. Which of the following beliefs will a nurse advocate as a method of coping with stressful life events? A. Avoidance of stress is an important goal for living. B. Control over one's response to stress is possible. C. Most people have no control over their level of stress. D. Significant others are important to provide care and concern. Question 168. Answer: B. Control over one's response to stress is possible. Question 168. Explanation: when learning to manage stress, it is helpful to believe that one has the ability to control one's response to stress. It is impossible to avoid stress, which is a normal experience. Stress can be positive and growth-enhancing as well as harmful. The belief that one has some control can minimize the stress response. Question 169. A student nurse is caring for a 75-year-old client who is very confused. The student's communication tools should include: A. Written directions for bathing. B. Speaking very loudly. C. Gentle touch while guiding ADLs, activities of daily living. D. Flat facial expression. Question 169. Answer: C. Gentle touch while guiding ADLs, activities of daily living. Question 169. Explanation: nonverbal, gentle touch is an important tool here. Providing appropriate forms of touch to reinforce caring feelings. Because tactile contacts vary considerably among individuals, families, and cultures, the nurse must be sensitive to the differences in attitudes and practices of clients and self. Question 170. When a husband takes out his work frustrations and anger by abusing his wife at home, the nurse would identify this crisis as which type? A. Psychiatric emergency crisis. B. Developmental crisis. C. Anticipated life transition. D. Dispositional crisis. Question 170. Answer: D. Dispositional crisis. Question 170. Explanation: a dispositional crisis is a response to an external situational crisis. External anger at work is the dispositional crisis displaced to his wife through abuse. An anticipated life transition crisis is a crisis that is normal in the life cycle. Transitional is one over which the person has no control. Developmental crisis occurs in response to triggering emotions related to unresolved conflict in one's life. This is called a developmental crisis based on Freudian psychology. Psychiatric emergency crisis is when the individual's general functioning has been severely impaired, and the individual has been rendered incompetent.